Good afternoon, everyone, and welcome to the Administration's Operations Budget Committee for Tuesday, December 2nd. We'll begin the agenda with item 1, which is the minutes from the previous meeting. I'd like a motion to move both 1A and 1B.
Second?
Been moved and seconded. Item 1A is the November 10th budget hearing minutes from the administrator amendments, and the item 1B.
Thank you, Madam Chair,
the
Commissioners.
November
My name is
13th.
Derek Woolridge. I'm the Business Information Officer with Hennepin Health. My name is Derek Woolridge.
Okay, I think they've got that cut. The second is item 1B is from the November 13th, 2025 meeting minutes. This is from the Administration Operations Budget meeting. So I've had a first and a second. Any corrections or changes? All those in favor signify by aye.
Aye.
Motion carries. Next are 3 routine items. I can have them moved all together, items 2A through 2C, if that's.
I'll move the block.
Okay, move the block. Block's been moved. Item 2A is ratifications of permit leases, lease agreements, and related property agreements approved by the county administrator from 7/1 of 25 to 9/30 of 2025. Item 2B is to negotiate an amendment to an agreement with the U.S. Swimming Foundation, extending the term to 12/31 of 27 with a not to exceed of $150,000. This is a new not to exceed of $400,000. And item 2C is to negotiate an amendment to an agreement with V3 Sports. Its term is 12/31 to 26, increasing the not to exceed by $125,000 to a new not to exceed of $250,000. Are there comments or questions about any of these? All those in favor signify by aye.
Aye.
Opposed, motion carries. The next item, item 2D, is an item for discussion and action. I'll move this. Do I have a second?
Second.
This is always our fun one. Hennepin County Youth Activities Grant Program, Fall 2025 Play Area Grants, Equipment Grants, Lifeguard Services, and Arts and Music Grants totaling just over $1.3 million. So can I ask for a quick summary on this?
Madam Chair, Jennifer Yang, the Director of Grants Management Administration, is here, and there is an R1 that we would like to have.
All right, I'll move the R1. It's been moved and seconded. Oh, that's right, they put in some corrections. Welcome, Jennifer. We need the mic on, please.
Oh, sorry.
Thank you. There it
There you
goes.
go.
My goodness.
Thank you. Madam Chair, Commissioners, good afternoon. I'm Jennifer Yang, Director of the Grants Management and Administration Department. I'm excited to share the recommendations for our Fall 2025 Youth Activities Grants. For the first time in the program's history, funding opportunities were offered concurrently across all grant initiatives. And those are play areas, sports equipment, lifeguard services, and arts and music. The Fall 2025 grant cycle was again very competitive, reflecting the community's interest and the program's responsiveness to the community needs. The county received 90 applications altogether during this grant cycle. The review process for grant applications was a county-wide effort involving reviewers from multiple lines of business and also community organizations. The recommendation before you today includes 27 awards totaling $1,301,924. Of this amount, there are 4 awards for play areas totaling $804,640, 10 awards for equipment totaling $89,450, 4 awards for lifeguard services totaling $200,000, and 9 awards for arts and music in the amount of $207,834. The recommended grant awards will allow for over 12,300 children of all abilities and backgrounds to benefit from increased opportunity and access to youth activities. I'm happy to answer any questions. Thank you.
Colleagues, this is always a fun thing. What a great spread to the opportunity. Anyone? Go ahead, Commissioner Edelson.
Very supportive. If anybody's listening that controls the AC or the heat temperatures, if you could turn it down a little bit, I'm cooking up here. Thank you.
They usually were cold, right? No, the grants are great. Very wonderful, thank you. All those in favor signify by aye.
Aye.
Yes, it is warm in here. Okay, we have several items for addendum, and since we're gonna have to go through these one at a time. Item 2E is establish Hennepin County Reparative Justice Research Task Force. This is offered by Commissioners Conley and Commissioners Green. I'm sure one of you would like to move it and the other second.
I'll move it.
And who's gonna speak?
I can kick us off. Thank you, Madam Chair. I am very excited to bring this board action in front of us today. When we received our annual report from the Race Equity Advisory Council, it was very clear to us that there was a lot of very comprehensive things that we could do as a board to work to eliminate disparities in our county. And that is why the Race Equity Advisory Council was established in 2019, to be the voice, to be the experts with the lived experience to guide this 7-member body on what it is that we need to do to reduce and ultimately eliminate racial disparities. From 2024 to 2025, this comprehensive report that we've received has included exploration of reparations. And reparations isn't a word that should be scary. Reparations is something that municipalities and jurisdictions all over the country are starting to name explicitly and do the work that it takes to repair harm in our communities. This is called the Reparative Justice Task Force because in my view, restorative justice is more of a philosophical term that actually shares the same definition as reparations. It really is taking meaningful and active accountability and responsibility to work to repair the harm that is caused by historic discrimination, historic policies that were rooted in racism. And what the report from our Race Equity Advisory Council stated explicitly was that Hennepin County does have a documented history of racially discriminatory policies, including housing covenants, exclusionary zoning, unequal access to public services. And those are policies that even today in 2025 create significant racial disparities in our county. It's not lost on me that we have been a diverse county board for only 6 years. 6 years ago, 2 of us made history and diversified this board. We are still establishing firsts in our county, and that is because, in my opinion, and in research, that for many, many years, people who look like me, people regardless of where they show up in society in their socioeconomic status or level or zip code, don't have the same access that others do. And so I understood the assignment from our Race Equity Advisory Council and wanted to my staff to craft a bar that really reflects what was in that report about the establishment of this committee. It was important to me, though, that the REAC have the authority to work with county staff to establish the membership, the meeting schedule, all of those things. Because this was kind of fruit of their labor, it's important to me that they have the ownership of that labor to say, to establish the group and then report back to the board. And I am looking forward to the report back. So that's how I wanted to sort of introduce this kind of it's a staff directive to work with our REAC to establish this group and also spend the next year forming the group, identifying who should be a part of it, and then giving the county board actionable steps to repair harm based on the harm that this county caused Black and Indigenous communities in the 170-something years that it has been a county. Thank you. I'll pass it to Commissioner Green to add.
Thank you, Madam Chair, and thank you, Commissioner Conley. I'm excited to bring forward this bar in partnership with Commissioner Conley to establish the Reparative Justice Research Task Force. I want to thank Commissioner Conley and her staff for putting pen to paper on this, and also Hennepin County's Race Equity Advisory Council for its work generally, and for bringing forward bold recommendations. The REAC's recommendations on this particular topic exemplify to me what the REAC brings to the table: a thoughtful first step on a topic that's big and challenging, complex, and important and necessary, grounded in particular understanding of the issue driven by community voices. The establishment of a reparative justice research task force fits as the county has shifted efforts and language from disparity reduction to disparity elimination. The conversation about reparations and reparative justice began for me when recreational cannabis was legalized at the state legislature. At that time, I spoke at a briefing in this room about how revenue from cannabis sales should go to those differentially impacted by the criminalization of marijuana. Commissioner Conley and I discussed it at the time, and the idea percolated. On the heels of the murder of George Floyd, the civil unrest, and the global outcry for systems of oppression to reform, with Minneapolis the ground zero, Commissioner Conley and I shared the desire to see cannabis sales tax revenue steered with intention to continue addressing long-standing racial disparities, which we all saw exacerbated by the COVID-19 pandemic. There are examples of jurisdictions around the country using cannabis revenue to support community programming, racial justice efforts, and reparations, including Evanston, Illinois, directing a percentage of sales tax for housing assistance and wealth building to Black families historically redlined, and Portland, Oregon, directing a percentage of sales tax to economic support for underserved communities and Black-owned businesses. This generation, it's estimated, Black Americans and people of color have been arrested 3 to 4 times more than their white counterparts for marijuana possession, despite studies indicating generally the same pattern of marijuana use across ethnic groups. The structural targeting of Black, Indigenous, and people of color has led to deeper disparities, limiting employment and housing options, risking family separation, and generating increased exposure to the criminal justice system, which can increase likelihood of future arrests, all of which limit stability and wealth-building opportunities. And this is just one example. We know that in our country, our history and our current systems have targeted and continue to target and treat residents differently based on ethnicity and race. Establishing the task force continues to acknowledge that reality and continues work to repair those harms. This is our work as a county, and I say, as commissioners, this task force is a step on that path. We're at the very beginning of what this task force will produce. I'm enthusiastic about what's possible. I believe it to be fundamental to the county's overall goal of disparity elimination in Hennepin County. Thank you.
Thank you. Colleagues, would you like to speak to this? Comment on that? Commissioner Anderson, then Lundy, then Allison.
Thank you, Madam Chair. Thank you to both of you for bringing this forward and starting this conversation. I want to start by naming something, and I think you addressed this really well, so I thank you for this, is that I don't think we need another report on harms that have happened. What we need is what actions we can do about it. And I am really looking forward to that work coming to fruition in partnership or in like merging in with the disparity elimination line of business, because we have taken some very concrete actions to systematically and institutionalize the work of being able to repair the harms that have historically happened. And I'm very proud of that. One thing that I think we need to make sure that we are doing is that we are, this work is precise in the role that Hennepin County is playing in this ecosystem. Hennepin County certainly has played a role in historical discrimination and racial profiling and causing harm to communities of color, but we weren't the only bodies of government as a part of that. And so I think part of this, I think we want to make sure that our responsibility is to identify where the county level policies or practices have contributed to that harm, and then not to take the entire scope of the harm that has been created and put it on our plate solely. I just want to make sure that we aren't biting off more than we can chew as a county, I suppose. We do have an obligation to repair the harm that is ours, but I don't want us to assume the obligation to repair harm that is others. So I hope that tension is well received. I hope that the recommendations that come out of this, what I hope to see is to identify specific county policies that created the specific disparate impacts, outline whatever corrective actions is appropriate and legally permissible, because we certainly live in kind of a narrow focus of what we can and can't do sometimes. I'm also very interested in what resources are available and required to do the work. You mentioned cannabis sales. I would love to see what else is available to us to do this work. And I want to clarify also in this what we can't do, because I don't want to mislead the public on like overselling our ability to solve harms that are in our communities, very real harms. I also want to just name another source of tension for me individually. We live in a current political environment where this type of work is often targeted by the federal government, who we have a reliance on to do the work of repairing these harms. And I don't want us to jeopardize the ability to do the work by the investigations of how to do the work better. I don't know if that makes sense, but we have so many things that we are doing well, and I don't want us to put the work that we're doing in any more jeopardy, I guess is what I would say. So I think we need to be strategic. We need to advance our equity and repair while still complying with whatever federal funding requirements, so we don't lose the resources that make that work possible. And so I hope that part of this can provide us with some sort of risk assessment. And ultimately, what I really want us to see is the ability to expand our capacity to eliminate these disparities and not invite any additional fiscal crisis for this. I mean, I'm going to support this. I really want to see what comes out of it, because I really do believe that resolving and addressing the disparities that have existed is a part of governing efficiently. But I want to make sure that we're doing it in a thoughtful and strategic way. Thank you.
Commissioner Lundy.
Thank you, Madam Chair. Just want to thank my fellow commissioners for bringing this forward. I will be supporting it. I wanted to add, I'll say, some realistic outcomes. There has been efforts across the country to look at this, and then the price tag comes back. I think of California as the first and probably foremost, and then it dies because the price tag on what people say this is how you repair harm, and I think theirs was a very large price tag. And then it sat, and I think that's also disingenuous to say, if we're going to say we intend to not just study it, but also act upon it, we need to have stuff that are realistic. I also very familiar with Evanston's model. It's successful, it's small. We looked at some of the programs that cities offer a couple years ago that made the news, made a great article, Star Tribune, and everybody talked about how innovative it was. And the absolute number of people who used it after 3 years was a sum total of 0, because it was a good idea on paper, but it didn't reflect how housing is purchased. How does that process work? How fast things move? How do agents work? And so I think there's good stuff. I think Evanston has a good model when I think about housing. They're a good example. I just always worry that we come up with a plan and we come up with here's what we're going to do, and then it makes us feel good, but it doesn't actually deliver on that. And so I think this is a good start. I just want to be realistic because I just think of the California model where they came back with a report and they had a very large price tag that the state still hasn't acted upon any of it. And they sign up for everything in California, so it's surprising they didn't find a way to do it. But so I think this is good stuff. I think there's some really good stuff we can do. I think we should be surgical. I think we can do some really good things, and then also measure the results of those actions. And if things don't look good and aren't working, stop them and double down on the stuff that we find out that could be working.
Commissioner Edelson.
Thank you, commissioners, for bringing this resolution. I had looked up when REAC was doing their presentation, and I had sent to Commissioner Conley to just an interesting 10 different counties across the United States have actually looked at reparation working groups to see how to address this. So I appreciate the bar, and we'll be supporting it today. One of the things that that I just noticed, though, in looking at it, that I would encourage us, and I mean, I don't think anything needs to change in the bar, but the work that Hennepin County has done, that I think there actually has been a lot of really good work that you guys have done, I mean, before I got here. Though there's been some since I've been here, I'm just going to say too. But there's been some really good work that with disparity elimination, and it was reduction before, but there's been a lot of really good investments. And honestly, the state of Minnesota has done a lot too. So I would just encourage the REAC advisory group when they're looking at that. I think it's really important to look at the large scope of what the state has done, what the county is doing. And also I would encourage, and I don't see cities in here, but cities are also doing this work. So we comprehensively need to look at all of that because it's just, I think, honestly, the report is good because it has us look at one place where it's what are we doing, how are we doing, and then what are other additional things we need to do. So thank you.
Commissioner Fernando.
Thank you, Madam Chair. I also extend gratitude to my colleagues and to Chair and Vice Chair of REAC, who I believe are in the House. So thank you for that. Oh, that was a very coordinated wave. What is really incredible about this is it's Reparative Justice Research Task Force. The word research is, I think, very meaningful here because it is rooting in informed decision-making, community-driven recommendations, and a research process has a journeying involved in it. I think we are often, as policymakers, trying to see the recommendation or the conclusion. But for me, reparative is a more dynamic word than reparation. Justice is certainly a dynamic promise and one that I wish for us to be better at writ large. And then the research element, I think is quite meaningful because you're hearing a lot of different feedback here. I saw the reporting to REAC, so it's not quite a subcommittee, but really an extension of the 5+ years of work that REAC has cumulatively been able to build upon. I think some of what colleagues are expressing is we are seeking to further bolster our Hennepin's engagement in this space, but we're not coming from nothing. We have our own journeying. We have the journeying that we've inherited by these seats or in this geography. And we have entrusted with REAC members representative democracy truly at work through resident appointment, really, to come forward every year with a set of reports and recommendations. And so I think assessing the reparative, how we might assess your past recommendations and our past work through this new kind of lens and framing, I think will be quite illustrative. And since we happen to be one of the only counties, I believe, with a formal research relationship with our flagship educational institution here, I do wonder what it would look like to be more entwined with our local research institution and to be more specific about the types of recommendations that institution is bringing forward. Mentally raise your hand for any report that you've read that recommends policymakers do something. policymakers is too broad. We just said it here. It's county, it's state, it's city, it's parks. It has to be the right year. And so really inviting that nuance in that guy, and I know that I'm kind of emphasizing the research aspect, inviting that nuance and seeing this as a dynamic commitment versus a single report or vote is how I'm experiencing this. And perhaps it is because of the time period where we're in, where people feel very unsafe because people are not quite safe. There's not due process on the streets right now. There's really overt experiences and footage of mistreatment that is completely outside of Hennepin County's values. So I feel very moved by this action, and I thank my colleagues. And I'll also shout out that Commissioner Conley also authored the REAC board action, so should certainly a very divided vote at the time. Barely got through, actually. And so this is an extension of that previous commitment. And so I thank you. I thank all of the REACT members. I thank the staff that have engaged with working with the building of a resident body, right? A resident group to develop community-driven solutions that intersect with governance that we didn't all invent. So I extend gratitude, I extend my resolve, and I very much look forward to seeing the many ways that this comes back before us. Thank you, Madam Chair.
Thank you. I also want to thank my colleagues for bringing this forward. Thank you. And I want to specifically talk to REACT and the board members and say, I think one of the things that when the first REACT boards came, they said, well, what will you do with this? What will you do with this? And we talked about maternal health, and we put $1 million toward that. Then we put $2 million toward that. I mean, this is so vital. The things you do as a volunteer, we really take it very seriously, what you bring back to us. Let them know that the quality of your work matters and that we really care about what you're doing here, and we're willing to take action on it. So it's not just your board, but all the boards that serve the county board. We can't do this work. It's too much for us to do it on our own. We really do rely on you. So you're much appreciated. I want to say that. I also want to echo what Commissioner Edelson said about great investments that we've already made. This is true. We've made good investments. I mean, we even put a department together. We've hired people into this. But I see this as the next step we need to make. That's what I see. We've done all those things. This is the next best step for us to do. I mean, when I look at this, and I think about it too, as we look at it, and I'm looking at it as a research piece too, some of the things I think about is making sure those voices of lived experience. I never saw that as so valuable as when Commissioner Conley and I first served on the child well-being together. Because sometimes things fail because those voices weren't at the table and say, that's not really what we needed. That's why nobody came. So we need to make sure that we're doing something that's meaningful to the people we serve. And I also like to think about our Native populations that are here too. When they talk about things, they talk about things in 7 generations. We need to make sure what we're doing is impacting 7 generations ahead. They look at it that way. We should be looking at it that way as well. And so sometimes too, there's large price tags to this, but I'll never forget, I was on mission one time and I met this really wonderful bishop out in Africa, and I said, well, look at how immense this is. I don't know where we get this money. And he says, what can we do right now, though? Where can we start with this vision and this dream? So let's not give it up. Let's just start somewhere. It will grow if we keep seeding it. And so I'm always about what can we do and where can we start? And I think this is a good place to be. Go ahead, Commissioner Conley.
Thank you, Madam Chair, and thank you to my colleagues. Really, really great ways of looking at this. Just a closing statement for me, and that's just that I wanted to just also, the research component of this is so important because there's a lot of examples. Commissioner Lundy brought up some in California. So the city and county of San Francisco, for example, had a move to get $5 million out the door. There was not a calculation involved in that. It was basically for the purposes of taking money and giving it to residents. It was for the descendants of slaves. And then the entire state of California had done some work along this issue. They created a task force to finalize recommendations, and those recommendations wanted to see 1.8 million residents get $360,000 apiece. Very ambitious, but a hefty price tag. What I appreciate about this being rooted in data collection, research, maybe partnerships with HUP, our institutions that do this kind of research is to Commissioner Anderson's point, the scope being Hennepin County. What existed in Hennepin County that was disastrous, that deserves reparations, that deserve a reparative framework, and keep that scope to Hennepin so that it is targeted to what it is that we can do, that we supported, or that historically we were a part of, that was disastrous for people's lives. So that research and data collection from this task force, which a task force is tasked with doing a thing, right? So I'm really excited for the future of what is to come for this, but the scope is important. And the research is important because what can be learned from Evanston, or what can be learned from San Francisco or California? And let's not do it that way, but here's some things that we can do. And if Hennepin is going to do anything, we're going to do it with greatness and love for our residents. I'm just going to say that out loud because I believe it. I appreciated in the Race Equity Advisory Council in your report this year how immediately following the reparations section was a full section on our Indigenous relatives. And so the reason that you see the Reparative Justice Task Force including Black and Indigenous is because I saw those two combined. You can't really have a conversation about reparative justice without including our Indigenous relatives in that. This is Dakota land that we are on. And it's part of, I think you even say it, like building off of our land and water acknowledgement. So I see that this is a task force. This is a research task force that will look at the harms to Black descendants of slavery and our Indigenous relatives and how Hennepin County was a part of doing that. I look forward to the research that this body of, I'm sure, thought leaders will come up with over the next year to be able to give us some really groundbreaking, I think, recommendations on how Hennepin can move forward. So thank you.
Commissioner Green, you wanted to add?
Yes,
thoughts?
thank you. I want to thank my colleagues for your remarks, all of which I found additive and really, I guess I'm just thinking about sort of the oral record of this conversation and, future years understanding the intent of this work. And I feel as though everything that has been said today really adds to the intent that Commissioner Conley and I were teeing up here. Especially as I scratched notes, I was thinking the specificity that everybody has mentioned in their remarks, that the identification of this as the next step, the shape of which will determine the next step, and appreciate that sort of layeredness to it. And then the fact that research is so much a part of this, that is what research conveys, sort of a thoughtfulness that really is going to be a part of this. Methodical nature to it as we assess other jurisdictions and think about them as they applies to Hennepin County. And then last and very much not least, I did not know that we had REAC leadership and members in the audience. So that's fantastic. And just a big thanks to you again.
Okay, any other comments? All those in favor signify by aye.
Aye.
Passes unanimously. Congratulations. Item 2F is to negotiate a lease agreement with Simpson Properties LLC for family safe space at 128 West 33rd Street, Minneapolis, starting January 1st of 26 through 12/31 of 30. It's $200,000 for the first year base rent plus ordinary operating costs. Do I have a motion?
So moved?
Moved and second. Further discussion, anybody? Do we need further discussion on this one? All those in favor signify by aye.
Aye.
Motion carries. The next item is 2G, which is a joint powers agreement with the City of Golden Valley Civic Campus Master Planning, starting January 1st, 2026 to 12/31 of 26, a not to exceed of $175,000. I'll move this. Do I have a second?
Second.
Does anybody need a synopsis of this one?
Just make a comment.
Please comment.
I don't need a synopsis. I'll just make a comment of my gratitude for this really favorable, in my opinion, multi-jurisdictional kind of expression that we can work across our, our lines to contribute to the local vision. I mean, that's what's kind of fun on the county level. We are local, but we have like a more localized set of leaders, and it is really quite an honor to get to weave that planning with our existing planning. It is cheaper is more cost affordable, I should say, for the taxpayer, and then there's a more kind of comprehensive or holistic view of how kind of that services and land use can be portrayed. So Golden Valley residents are quite excited. They'd prefer if the library was open yesterday and maybe 10 times bigger, but I digress. Thank you, Madam Chair.
Yes, other comments? Go ahead, Commissioner Anderson.
Thank you, Madam Chair. So I apologize for not having looked at this as closely as maybe I should have before. Where is the $175,000? Can you, maybe I would benefit from a brief synopsis of
Okay.
what this action does and the scope of it and where the money is coming from and all
Deputy
that.
Director, please.
Madam Chair and Commissioner Anderson, Brett Bauer is here from Facility Services and can provide some background on this item.
Welcome.
Thank you.
Mr. Bowers, please.
Good afternoon, Madam Chair, Commissioners. My name is Brett Bauer. I'm with Facility Services Planning. The board action you have before you seeks to approve a joint powers agreement for cost sharing with the City of Golden Valley for a civic campus development that the city is pursuing and the inclusion potentially of a relocation of the Golden Valley Library. Our fees are 20% of the cost of this consulting agreement that's going to be moving forward. Leadership has met with the city from the county and has agreed to consider a relocation of the Hennepin County Golden Valley Library as part of their civic campus redevelopment project. They're calling it, they're building forward Golden Valley, and it's supported by local sales tax that was approved in 2023. The city has a 12-acre campus currently that houses their city hall, their police and fire, and public works facilities. They're in the process now of relocating their public work facilities as part of their redevelopment plan. Our county library is on a 3-acre lot just to the north. Their campus is on Winnetka, which is County Road 156, just north of 55, and they have their iconic water tower. Our campus for our library is a 3-acre site just adjacent to their campus. Our library was built in 1971, 54 years old. It's on the banks of the Wapadon, which is the indigenous name for Bassett Creek. And due to the library's age, outdated design, and significant infrastructure needs, this is a timely opportunity to partner with the City of Golden Valley and move forward. We went out with an RFP. The city and county staff jointly put an RFP out for architectural engineering services. We've received 12 proposals. We interviewed 5 firms, and the city is currently negotiating with a firm to conduct just this master planning option. It'll be done in 2026. And if there is a path forward that the county supports, we would develop a comprehensive development agreement with the city and operational and identify future costs within a capital budget project in the future. The City Council is having this joint powers agreement before them on December 16th, the date that their consultant contract will be approved. Thank you, and I can take any
Thanks.
questions.
Commissioner Anderson, do you have questions to follow up?
Thank you. I really appreciate it. And just knowing the current financial situation that we find ourselves in, is this $175,000 part of our 25 fiscal budget? Is it part of next year's budget? Where is the money coming from? Because I feel like we're shaking couch cushions for pretty much everything at this point. And so I just want to better understand the impacts of this money on other projects and where it's being spent.
Yes, Madam Chair, Commissioner Anderson, the money for this project is coming out of a prospective capital project that's in the 2026 capital improvement program. It's called the Golden Valley Replacement Library, and it's currently up for approval on December 11th for $250,000 for the year of 2026.
Perfect. Thank you so much.
Other questions? All those in favor signify by aye.
Aye.
Opposed? Motion carries. Thank you. The next is item 2H, which is agreement with Alliant Insurance Services, Inc. for actuarial advisory and compliance services in support of the design, administration, and communications of employee benefits plans sponsored by Hennepin County starting January 1st of 2026 through 12/31 of '28 and not to exceed of $975,000. I'll move this. Do I have a second? And I would like a short summary on this one.
Certainly, Madam Chair. Alyssa Johnson from Human Resources is here with us
Welcome,
via
Alyssa.
Teams. Alyssa, we can't hear you right now. Oh,
There
now
we go. I
can.
hear you.
Can you start over?
I can. Thank you, Madam Chair, Commissioners. I'm Elisa Johnson. I am the Senior Department Administrator for our Total Rewards Benefits programs. This BAR seeks to enter into a contract with Alliant Insurance Services for our HR benefits consulting supports. We have had an HR benefits consultant for many decades, back to 1977. This BAR went, or this RFP went out last spring. We had representatives on our panel from HR, LR, and OBF. We had 3 vendors submit proposals, and Alliant was the unanimous decision by that panel. Alliant was chosen based on experience with public entities, their inclusive pricing, a tailored approach to consulting services, their scope of services, and their cost. Alliant provides a broad array of services, including strategic planning, actuarial cost and benefit use analytics, legal and compliance guidance, RFP and contract, deliverable supports, vendor relationship management, data warehouse reporting, federal reporting requirements. They'll do a benefits return on investment analysis, and they have a dedicated public sector team. Their public sector division supports numerous public entities, including NACO. Their cost structure will result in a $200,000 overall contract savings as compared to the other 2 proposals that were received as part of the RFP.
So there's actually a cost savings here. How do they manage into a cost savings?
They have inclusive pricing, and that means that all of the services are included in the one cost, which is $325,000 a year for 3 years to the net not to exceed of $975,000. Our current vendor and other vendors have more of a cafeteria plan. Currently, we're paying less per year. But with the new cost structure, the other proposals brought us up to a higher amount than Alliant proposed. And their cafeteria plan means that the services that are included in the overall cost, the $975,000, would be costed out separately via additional statement of work projects with different cost amounts. When those cost amounts were added in, the estimates, that took them over the amount that Alliant was proposing, with Alliant then being the best cost option for us.
Okay, right. Other questions, comments? Go ahead, Commissioner Anderson.
Sorry, I'm the only one asking the questions
I
here.
did.
But just a question is, does this cover any subsidiary health benefit or HR benefits that Hennepin might have oversight of?
This provides consulting services specialized in all of our health benefits. So our health, our pharmacy, vision, our Medicare plan, they provide supports with our leave packages, our life insurance. So really all of the benefits that were offered as part of Total Rewards.
Okay.
Chair, Commissioner Anderson, this provides services for Hennepin County, but not for our subsidiary.
Okay, thank you.
All right. Any other questions? All those in favor signify by aye.
Aye.
That motion passes. Item 2I is an amendment to an agreement with Neighbor Works Home Partners for Home Buying Assistance Program, extending the term to April 1 of 2026. No change to the exceed. Do I have a motion?
I'll move it.
Second.
Second. Does anyone want any further information? All those in favor signify by aye.
Aye.
Motion carries. Item 2J is exploring Ordinance 18 amendments as a funding source to further accelerate zero waste implementation. This is offered by Commissioner Conley. Commissioner Conley.
I will move it.
Second.
It's been moved and seconded. Would you like to speak to this,
I
please?
do. Thank you, Madam Chair. And thank you, colleagues. You'll remember this fee booklet.
Yes.
So when we were having our hearing, yes, I brought it with me. I just remember going through these fees and seeing Ordinance 18, and the possibilities just seemed like they were just sitting there waiting to be taken advantage of, and that's what this bar will do. So what really caught me up is Ordinance 18 is a county collected solid waste fee, solid waste management fee, and it was created in 1995. So it's a 30-year-old ordinance that has been sitting on the books. The rate right now is set at 0, and it has been at 0 for since 2009. So the purpose of the ordinance, though, is to, fund waste management programs, including waste prevention, recycling, composting, and other preferable waste management activities. The point of contention here is that there was to be a rate set by a fee, but that is at the market value of taxable property in Hennepin County. The reason that stood out to me is because I want us to be able to use this ordinance, but in a way that it's not just on the backs of every property taxpayer in Hennepin County, but let's look at our biggest waste producers. And so what this bar does is it will allow county staff, it's really a staff direction, to allow county staff to do a few things, and that's to evaluate amendments to Ordinance 18 that would allow for us to accelerate the implementation of zero waste actions, and analysis on what potential revenues we could collect from this ordinance that is already on the books, especially from, or particularly for, the biggest waste producers in our county. And then to develop options, including recommendations for that new revenue, along with proposed public engagement process and timeline to implement and provide to the board by the end of the first quarter 2026. So ultimately, we have been in the business of accelerating zero waste for the sole purposes of, one, it's better for our environment, it's good for Hennepin County, it's good for the residents of Hennepin County to move towards zero waste, but the onus isn't just on the end user. In my opinion, we need to hold all accountable for the large amount of waste that goes into our incinerator, because we have a goal to close that thing. And I think that we do that through things like what you see in the background of this board action, which is evaluating what ordinances are already there that we could use just by restructuring them or amending them to bring in revenue for continued work to increase the acceleration of zero waste in our county. So that's what this is really about. It is directing staff to look at Ordinance 18, and there could be others, frankly, that are on the books, that are older, that could be revamped to 2025 standards of where we're at today in terms of accelerating zero waste and collecting revenue. So there's been a lot of talk as we've, sort of been dealing with the landscape that we're in about looking at new sources of revenue to do the great work that we do. We do incredible work around zero waste implementation right now. We've got grants going out to community organizations. We've got education for residents of this county on how to reduce waste. But and we've got a packager legislation that passed, packaging fee waste that's coming to fruition in a couple of years. But for what we can do right now is look at our own books and say, what can we do differently, or how can we bring in revenue based on some of these older ordinances that we have. So I think I'll leave it there. This really is asking staff to really dig in to Ordinance 18 specifically, but again, there could be others, to look at revenue sources for one, and who we collect those revenue sources from. And it says here that we will be looking at the biggest waste producers in our county.
Well, I just want to say that I applaud you. You are always talking about finding new sources of revenue, your endeavor, and I support your endeavor of always trying to do that. I appreciate that that's one of your talents and skills. So I think we should be looking and turning over every rock and under every cushion too. So I really appreciate that you brought this forward. Does other colleagues want to comment on this? Commissioner Edelson.
Thank you. Overwhelmingly, I'm supportive of this. I just would caution us. I would caution us a little bit when we're approaching looking for revenue, because when we look for revenue by passing it to possibly commercial. Now, we were just actually at a composting tour, Commissioner Conley, and we learned about some businesses that had some practices that were interesting. So certainly, I think there's room for improvement. But with the Producer's Responsibility Bill, which takes place in 2032, I think 2039 is when some of it starts. We have tariffs right now. We have a lot of costs that are happening. So I guess what I would just say to staff from my perspective is we really also have to just be cautious about looking at how much revenue are we trying to generate so that we're not passing it to the consumer, because it's going to happen potentially. So I just think we need to be cautious. But overwhelmingly, I think a study is just fine to look at where there's opportunities.
Commissioner Green.
Thank you, Madam Chair, and thank you, Commissioner Conley, for bringing this forward. I wholeheartedly support this, and one of the things that I like about how you've sculpted this and made it something we're sort of looking at, essentially, is in order to avoid perverse incentives and make sure that we do design a program that achieves what we want it to achieve, with the objective being zero waste. So thank you for the way you put this together.
Commissioner Anderson.
Thank you, Madam Chair. Appreciate as always, the exploration of other revenue. I will share the concern about the unintended consequence, or being very cautious about the downstream impacts to those least able to pay, which you included in here. And I want to make sure that that is, like, as we are looking at this, that we are looking broadly at how fees levied against an industry or hauler or whatever gets passed on to the end user. We see this in our organics collection. We see it in every instance that we levy a fee onto the people bearing the responsibility. It just gets shifted right back onto the consumer. And I know that that's not the intent of this, but we have to be very mindful of how we can protect ourselves from that impact of putting, like, a fee being transferred onto people who really just aren't able to pay it, an additional fee. My reading of Ordinance 18 is property tax based, which is, tied to home values, which should loosely be more equitable, perhaps, than a straight flat fee across to everybody. But if there are mechanisms that we can have a more progressive way of collecting the fee, I'm all for it.
Other comments? Commissioner Lundy, and I'll come back to you.
Thank you, Madam Chair. I think I would just ask staff, as I think it's going to pass, that I think any proposals come back, really identify using the funding. If unintended consequences or the intended consequences, I think that could be just part of the report back. I share the concerns, but I think we can ask for the report to kind of highlight that. So I think we're all eyes wide open before we actually were to consider adopting anything. So thank you.
Commissioner Conley.
Thank you, Madam Chair. I was just going to add to the current discussion that, yes, I don't want anything to be a burden to that. What the reading of Ordinance 18 stuck out to me too is that it's based on, the fee would be based on property tax payers in the county. But I want to shift that to the types of property tax. So when I look at my water bill in Minneapolis, it has your water, your sewer, your trash, right? And that is a bill that I don't want to go up. I appreciate the service, but that's in addition to a bunch of other bills that you have to pay. So this piece in the background about the evaluation will also assess how the potential revenue options would affect residents with lower incomes and small businesses to mitigate those unintended consequences. So it's codified in here, and I really have to give it up to staff. Staff really, I had this idea about Ordinance 18, and our public works staff really came in and helped draft this, what you see before you. So heavily worked with our staff on this, but am also thinking about ways that we can do this that's equitable, that doesn't impact the lowest incomes, that doesn't impact residents further, given that property taxes are something we just cannot rely upon to do the good work that we want to do in the future. So I'm looking forward to the end of March when we have options before us that do address potential unintended consequences, or how we can do this in a way that doesn't put a burden back on residents. I think that there's a lot of strategic thinking that will go in this, and in addition, again, just the evaluation of not just Ordinance 18, although this is specific to that, but like there may be other ordinances around solid waste on the books that could be revenue generators that don't impact us, but the evaluation around those options need to be done with a lens that doesn't harm those with the lowest incomes or our small businesses that make Hennepin thrive. So thank you.
Commissioner Anderson, you had something you wanted to add or a question?
Thank you. I really appreciate the added explanation, and something that you had mentioned, the working with staff, got me thinking about it's because we're in budget season, and we've been talking about a very difficult budget where we are holding staff, and we know that staff is being stretched pretty thin as it is. And I'm wondering if I could just ask administration, how much capacity do we have for additional projects? I know that staff does really an amazing job at doing whatever we ask them to do. But I want to know, if there is anything that falls off our task list by adding more onto.
Chair, Commissioner Anderson, thank you for the question. I think in a broader sense, clearly we're looking at where priorities are, and we'll be looking at those adjustments. In specific to this one, Lisa Cerny can speak to that and some of the thoughts around how this aligns actually with our staffing resources with our zero waste efforts.
Yeah, I appreciate that. Thank you.
Any other questions or comments?
I think she was
Okay,
just gonna.
okay, give us something, okay.
Sorry, Chair Gattell, Commissioner Anderson, consistent with what Administrator Wentland said, there's not an intention to drop off any of the work. This is just supplementary and really exploring options on how we can accelerate zero waste and how we can bring different revenue sources and things to the table to help us continue to do this work.
Thank you.
Other thoughts, questions? All those in favor signify by aye.
Aye.
Opposed? Motion carries. Thank you. Item 2K is approval of the 2025 Community Health Needs Assessment and Health Services Plan and adoption of the 2026-2028 Community Health Needs Assessment Implementation Plan as submitted by Hennepin Healthcare Systems. We have an attachment on that. I'll move this.
I'll second.
Mr. Rogan?
Chair, Commissioners, Dr. Thomas Clement, the Chief Executive Officer of Hennepin Healthcare Systems, is here and can provide background information.
Welcome. Thank you, Dr. Clement.
Thank you, Commissioners. Just a quick overview. The Community Health Needs Assessment is a base obligation that is part of our nonprofit IRS status. It is also, I think, foundationally important work to connect community and our efforts to a shared vision of what we should be providing. It's part of our health services plan, as you know, and it's, again, as I noted, it's accountability to community. We need to make sure we're providing what our community says is most important. We use data, we focus on anti-racism and disparity reduction, elimination, and accountability. It's a 3-year plan that we have for you. It takes a year to prepare it. That involves developing, reviewing data, finding more data, asking questions, collaboration again between Hennepin County, Hennepin Healthcare Services, and community leaders and community organizations. From there, from gathering data and conversation about what's most important, we look at where the health system is, what resources it has, and we develop a list of priorities that will be part of the 3-year plan that is before you. The 3 items that are the core of the plan from this process are community-centered prevention and health promotion, mental health and substance use disorder approach and treatment, and perinatal and child health. I think it's important that all of these are really derived with the lens of what does health mean? What does good care mean from a community perspective, not assuming that the prevailing healthcare perspective is the right one or the total one. Great opportunities for individual benefit and also systems change. So this helps focus our efforts on these things that have been found to be most important. So we are seeking conversation and approval by the board at this time.
Colleagues, do you have questions or comments for Dr. Clement? Go ahead, Commissioner Edelson.
Thank you, Dr. Clement. I'll be supporting this. I just want to note there were multiple testifiers at the very beginning of the meeting, and I would appreciate a follow-up with them. Thank you.
Okay.
Other comments or questions? All those in favor signify by aye.
Aye.
Opposed? Motion carries. Thank you. So, item 2L is approval of the 2026 Hennepin Healthcare Systems, Inc.'s financial plan. There's an attachment on here. I'll move it. Do I have a second?
Second?
Chair Gotels, Commissioners, Dr. Thomas Clement, Chief Executive Officer of Hennepin Healthcare
Welcome
Systems.
back.
Thank you. So quick overview of Safety Net Hospital. We're a subsidiary corporation. We have a mission to provide care for our community, all who come to us, particularly the most vulnerable. So this budget is result of an effort to be able to continue services and ensure quality patient care. Very significant challenges, as everyone in the room I think knows, many of which are beyond our control in terms of costs of healthcare going up, more patients being off of insurance or requiring care without ability to compensate. So it has been a very difficult 12 months, and I anticipate a very difficult another 12, 24, 36 months from here. Our days cash on hand have been very low in the single digits. We have had an operating loss now for 8 of the past 10 years. And the existential crisis that resulted in dissolution of our board and county leading in. So we appreciate that partnership, and I think it speaks to the severity of our condition. This budget is the result of exploring from top to bottom the organization, looking for efficiencies, looking for ways to generate revenue creatively or different streams. And it is a break-even budget. It is a zero-margin budget, which is, again, an incredibly vulnerable situation. We do anticipate, with the projections, being able to generate about $7 million in 2026, which might get us to 4 days cash on hand as a target. So we appreciate the collaboration on this, the kind of high points, growing revenue by 5%, which is an achievable target, we believe. The zero margin, as I noted, high productivity and efficiency at benchmark. So we're very lean across the board in working to achieve this. And a staffing ratio down closer to 66%, which is closer to industry standard. This also includes $25 million allocated for equipment capital, which was a challenge in 2025. I would pause there. I think we have cash flow and consolidating income statement, which includes HHF, our philanthropic arm, and HHRI, our research institute. I'll pause there and take questions.
I first of all just want to make a comment. I want to thank you for all the work. There's a lot of us who've seen this budget several times now in many iterations, and I know this was a lot of hard work, and I appreciate you getting to zero, and I think it's actually a doable budget this year. It's not a pie in the sky that we hope to reach and we won't. That deflates people's egos. I think this is actually doable and moves us forward, and I think it's also safe to say that it doesn't lay anyone off at this point, that we are really trying to save our staff. We know we need them. They're such great trained professionals that we want to keep as many of them employed in Hennepin Healthcare. We need you now more than ever, as we're going to face some huge, significant changes in the next few years, and we'll need your talent, your skills, and your ideas to save more money down the road. Colleagues, Commissioner Conley, then Commissioner Edelson, and then Commissioner Lundy.
Thank you, Madam Chair. I was just going to say, thank you. We set out on a goal to financially stabilize this hospital, knowing the importance that it is, the critical importance that this institution has in our community and in our region. And I think that this financial plan gets us to a very comfortable place for now. There is a lot more work to do. I think that goes without saying, but I think we have the right mechanisms in place right now to be very comfortable knowing that we are moving in the right direction to financial stability. That's the goal. That's where we need to be. And you've crafted a plan that is solid, in my opinion. We have become very familiar with this plan in the Finance and Ops Committee and just as the board. And so there's no surprises here. It's a good direction, and I appreciate all of the work that has gone into it. Thank you.
Commissioner Edelson.
Thank you. I'll echo the words of Commissioner Conley. Just very appreciative of your work. And while this work was hard, we know that the work now begins for next year's budget. And this administration is very clearly attacking people that are impoverished in this country and in this county. I mean, just today we're hearing about what is happening to HUD, what is happening to SNAP, and what's going to be happening to Medicaid. So the idea that we're okay right now is fine, but the work must begin right away for next year. And I honestly think we need to be as creative as possible. I don't think there's a lot of areas for us to get revenue. And I'm really concerned about what we're going to do about that and then the fiscal reality of that. Do we go to charity? What do we do? And so I think we honestly need true answers, and as leaders, we're responsible in this moment. And so it's a big burden to carry. And so I will just thank you for that, and then let's get to work.
Commissioner Lundy.
Thank you, Madam Chair. I also want to thank staff, not just for what you have done, what you are doing, but what you will do. The Medicaid cuts are spread out over 10 years, which means every year we get a present that says you start the holes a little deeper. And that means every year we have to approach it that we are already negative through no fault of our own. It's just the reality we are in right now, unless things change. And I assume we can't hope or believe in that until it actually happens. So I know that this work is just foundational to that. I think the stuff that the teams and the hospital and county and everybody involved is working about efficiencies. We know that if we are as efficient as possible, which I don't think we're there yet, but we're getting there at all levels, that will help prepare us for what's coming. And so I just want to really thank everyone for really digging in. I think as we gave a presentation to legislators a couple weeks ago, that we can't fix this problem for the state of Minnesota. We continue to be one that we accept people who arrive from wherever they arrive in the state of Minnesota. But other hospital systems around the country have said, listen, if it's not an emergency and you have uncompensated care, we may not take the referral. And that's something we haven't done. But I do think that that challenge we put to legislators to say, if we help fix just this, that doesn't fix the rest of the state, and actually may attract that we become the place where everybody goes, well, we got nowhere else to go. We're going to refer them to Hennepin healthcare systems, therefore deepening the need. Because as of right now, unless we get help from legislature, the only people who pay for Hennepin healthcare systems is the property tax owners of Hennepin County. And it doesn't matter where the person who needs care comes from the state, there is only one place that pays that difference. And so I know you're working on that. I'm saying that for the public, that we do need the legislature to look at a statewide solution. What is that? I don't know, but I'm not a legislator. And so I know that they have the wherewithal to look at a statewide solution because it's coming. And, I feel sorry. I'm a person who grew up in a place that didn't have a hospital. The nearest hospital was an hour away. I grew up with a younger sister who was born without part of her brain. that it was faster for my dad to get in a car and drive 120 miles an hour, be met by the sheriff at each county and kept going because you waiting for an ambulance to get out an hour and getting the sister to the hospital doesn't happen. And that has not changed. Math doesn't change the fact that it takes how many minutes to get a person of care. And so as this system is collapsing around the state, people are going to find themselves hours away from help. And if you think about, we talk about minutes. When I was mayor, we talked about 9 minutes was an average time. 4 minutes was an average time to get a fire truck and EMS to a house. We're talking 40 minutes in some parts of the state. And so we do need the legislature to help work with all of us, the counties, all healthcare professionals around the state to fix this. We're going to fix ourselves, but we can't take on the burden for the rest of the state. And we certainly can't help those. And I feel bad for them because I know what it's like to have to drive 2 hours to get to a place that might be able to save a loved one. I can tell you people think 6 minutes is too long here in the metro. Well, other places it's 60 to 120 minutes. So thank you, Madam Chair.
Commissioner Green?
Thank you, Madam Chair, and thank you, Dr. Clement. I wanted to thank you and the whole team for the work that goes into a budget like this. I especially was grateful for the sense that as we looked at forecasts and goals, that every question was answered with an assessment of the realism and everything felt realistic. So I didn't feel that there were, that we were sort of, we had rose-colored glasses on, and that, you know, there was just full understanding of the possible risks, et cetera, et cetera. So very appreciative of that. I also want to share the sort of chorus saying, like, we do need a statewide solution. We are a team on that. I remember when I was a legislator in 2011, touring HCMC, and guess what? We the legislature at that time were being asked for greater understanding and sort of financial reflection that this is really a statewide asset. And sort of what I want to say right now to those legislators listening at home is the gig's up. The pockets are inside out. As was alluded to earlier, the couch cushions have been shaken, the rug has been vacuumed. There's no more change between any cracks around to enable us to pay all the bills for the state. And it's present tense that people are being sent to this fantastic institution from across the state. It's an amazing state resource, but we need state support in order to fund it. So I just wanted to thank you, acknowledge that into the microphone, and particularly thank you for the sort of serious tone that I think you set, because there's no sugarcoating, and I really appreciate that. Thanks.
Other comments, Commissioner Anderson?
Thank you, Madam Chair. Echo the appreciation for I think the realism of the plan, and also I'm going to say it, the cautionary tale that, you know, we've heard the realistic plan and we've met like growth targets and expenses have still outpaced the revenues that we've brought in. And so the realities around healthcare haven't gotten any easier for us. And I just want to express, like, this next year, 2 years, 3 years, 10 years is going to be incredibly difficult because of things that are well outside of our control. And we will need the state and at some point, hopefully, a federal government to support healthcare in this country. And there are going to be very, very difficult decisions made, you know, over the next few years on how to make sure that that we are at least moderately comfortable. Like 0% isn't necessarily comfortable to me, but I do appreciate the amount of work that it took to get there. And know that, we'll be here at every step of the way trying to think creatively about how we can continue to stabilize and support the workforce and the hospital to make sure that healthcare delivery in Hennepin County is still top tier for every resident. So, thank you.
Commissioner Fernando.
Thank you, Madam Chair. I appreciate everyone's optimism on this budget. I was going to express, and I'm glad I went last to not disrupt the wonderful, I don't know, everybody was saying it's realism. I'm like, oh, this seems very fragile from my perspective. A lot of hard work, not a reflection of the efforts. From my perspective, I've seen many HHS budgets with pursuits nearby. Now, my colleagues are correct that in the last several months and the last several years, quite frankly, I want to extend gratitude to the HHS board members that I've been able to serve alongside and those that have served in the decades previously. It was a tough climate before, and it's only getting tougher. And so I'm noting that we believe we will have more revenue and fewer expenses, which I understand is the objective. But there is a fragility in that, and I want to express why on the county side, myself and others have also expressed the need, and I want the public to hear this. I want residents and legislators, whomever is listening, that this is not like, I can't believe I'm saying this, but this is not like 2020 and 2021. I was on the HHS board at that time period. This is more fragile somehow, and I want to just clock that because we will need, in my opinion, to be much, much more pronounced with our consolidation of shared services. Again, nothing that's new. Really, really pronounced in our analysis of the data related to all of the drivers of this, and that's all of it. Productivity, support structures for workers, compensation, consultants. So I want to express some of these words that we have been privileged to receive that feedback from residents, patients, and workers. And we do hear you. We're just not able to give it all in this in a speech in this moment. So while I say it's a fragile budget, I will also say that it was quite literally not even 6 months ago when you expressed that HHS might close. So we have to hold those in tension with immense pride that we as a county, the residents who rely on us, and we as a board with Hennepin Healthcare System stated that we must have this service open and continuous for patients, workers, and the community at large. And so while I'm saying this is a fragile budget and one of the reasons why we are more activated than previous years is because of our resolve in ensuring that you and the workforce are supported in achieving some version of these measures and perhaps inventing additional measures as we kind of get straight to work. So really incredible progress in the last handful of months. And relative to the task at hand, I am very, very eager to remain in deepened partnership and to be even deeper into the data there's so much data at HHS that we can be pursuing for the betterment of patient care, worker experience, and of course, the taxpayer. So you're going to hear from us many times in the next year. So I want to extend gratitude. And just for those watching at home, I guess I'll cover this in the next bar. Never mind. Thank you, Madam Chair.
Okay. Any other comments or questions for Dr. Clement? No further comments. All those in favor signify by aye.
Aye.
Opposed? Motion carries. Thank you, Dr. Clement. Item 2M is direct comprehensive study of Hennepin Healthcare Systems, Inc.'s governance offered by Commissioner Fernando.
I'll move it.
I'll second. It's been moved and seconded. Commissioner Fernando.
Thank you. So thank you, Madam Chair. So for those watching at home, the 7 of us commissioners are committees of the whole, and similarly, we're also the HHS board while also being the county board. Why am I saying this? Because at a previous meeting of the Hennepin Healthcare System Board, there was a discussion around governance and its timing with respect to kind of sequencing, leadership actions. And after kind of reflecting on that experience, governance really resides with the county board and not the hospital board. And so I brought that to council and to the administrator to see what resolving clause, or excuse me, what resolution might make sense from this body in order for both the county board and potentially the hospital board to engage more in an informed manner regarding governance options. So that's why it's here. This was meant to be a reflection of our discussion when HHS Chair Lundy was chairing. And so I am very open for this being progress if that's what's needed, because this was meant to reflect our discussion. But I do hope that colleagues see themselves in the resolving clauses, and should it be satisfactory to begin, I would appreciate it, prevailing so that people can get to work on it, if that's all right. So that's all I guess I'll say for intro. Happy to further discussion, Madam
Commissioner
Chair.
Anderson.
Thank you, Madam Chair. Thank you, Commissioner Fernando, for bringing this forward. Very supportive of this. I do see kind of what's in here, and if I don't know, maybe it doesn't need to be said, but in our original motion to take control of the board, we had directed a report back by no later than July 31st, I think, of like financial stability and governance. And so this has a June 30th, which I appreciate the advanced timeline and like the moving forward of it. And I just want to make sure that we're not duplicating, that this covers that governance part for staff. So this is my just kind of verbalizing that I appreciate this coming forward. I look forward to the engagement of the work that's happening, that's directed in this, and ready to get to work on it. So
May I?
yeah, please. I'm sorry, I'm not the chair.
Go ahead, please, go ahead.
Yeah, thank you, Madam Chair. And Commissioner Anderson, I hear you on the date. So the original action from early August, you had amended to have a report. If I've learned anything about this org, there's always more information and more reports. So I have no doubt that there will be more revision at the date that your amendment outlined. The last resolving clause here says progress report by March 15 and recommendations by June 30. What I was trying to be responsive to was the feedback around hiring a leader and searching for a leader. And searches usually begin with what is the job description, who do you report to, and in this instance, the governance structure would just end up being quite a discussion. And so the intention was to sequence and just to get more of that work done earlier, so that should either the county board or the hospital board made up of these 7 commissioners wish to act faster, then we would have some amount of information kind of earlier than those previous dates. So that was truly, colleagues, the intention was to be reflective of the discussion, and just noting that at the time of that hospital board meeting, this was just the only cycle left, and wanted to make sure that should something like this prevail, that county staff could get started on it as soon as possible. Thanks, Madam Chair.
Okay, Commissioner Edelson's next.
Thank you. So I'm supportive of course, having more a governance discussion. I was talking about that at the last one, when I also think that we should have already started the CEO search, but I understand governance. We are still figuring it out. I guess what I would say on transparency is it's really hard for the public to be able to engage with this board and with government in general if we don't have timelines set out clearly. And I feel like that's lacking right now still. Right now, so supportive of what you're trying to do here. March, then we have June. We're going to start by June of 2026. We're going to start the CEO search. But you have to dig to find this, and you have to be watching the board meetings. So the public, I think we have to have one document where we can have a timeline. I've requested that, and then Commissioner Lundy, as the chair, I've requested that from you as well, and I was going to bring that up at the next board meeting. we're a little delayed, in my opinion, on the CEO search, but I get it if we need to have the governance discussion. But I want to just go to what this bar actually says on what was successful, but what wasn't successful. So I think that's a really interesting question. And when I guess I don't know because I wasn't on the board before, is do we have key performance indicators so that the board before actually knew exactly what we expected of them? Did we ask about board effectiveness and engagement, oversight, strategic alignment, compliance and regulatory oversight? When's the last time we as a board did that? Was it when we established the board? So if we want a group to be effective, we have to be changing the policies and really looking at the direction that we're giving them. And I guess whoever is going to, that was actually my other question, is so we're passing this. So it's directing the county administrator to do this work. So they're going to be identifying the aspects of past governance, what was successful, what wasn't. So I guess I would ask the county administrator, typically when you look at a board like this, you'd look at key performance indicators, but also who else outside of you is involved with it, right? It shouldn't just be the county administrator, it should be staff. It should be people from the hospital. We had many people that were here today testifying. I'm sure they would love to give a little bit of feedback there. So it should be the public. So it shouldn't just be us in our siloed, little area where we're getting to decide this on this own. This hospital is an asset for this county, and so I just would request that if we could expand what success actually means, because I think if you want something, we have to be very clear about what we want. I learned that through marriage, and thank you for listening. And then also, I just think that we should involve a broader than just the county administrator. And no offense, county administrator, I think you're amazing. So I'll end with that. And then also, it's still really hot in here. So thank you.
Commissioner Lundy.
Thank you, Madam Chair.
Excuse me.
I just want to acknowledge the comments on the, I tend to have little frequent touch-ins with Dr. Clement, Mr. Huff, and Dr. Krosnan. And, some of the other models across the country were intriguing to hear about. But you have a chief medical officer, you have a administrator, you have different things, a dyad, a triad. And I would never say any of them are the best solution or the worst solution. But I do think having this to kind of go out and study and come back with ideas, because I'd like to hear, did it work? I mean, if someone moved from a single CEO to a dyad, what did they see? And those are kind of things we can suss out. We can have conversations with other hospital staffs to say where they saw the strengths and weaknesses, and we can learn from other people. And so I think that's a good step, because I think to Commissioner Edelson's point, bringing a CEO on, we don't even know what they might be brought into. And I'm intrigued by some of these ideas. There are multiple ways to do this. At the end of this rainbow is a pot of gold we're all trying to find. But how we can manage that process, I think, is important. So I think this is a good step. I think there's some really good ideas. Every time I have meetings, we talk about these different options that are out there. No one is perfect. No one is the perfect fit for any particular solution. But I'd sure like to have that information kind of presented and give us a strengths analysis, weakness, and then. But I do want to acknowledge Commissioner Ellison. I do think having those metrics are important, because who knows? Maybe we were wildly successful in how we did things, but I don't know, because I look at other hospitals around this state that are closing or no longer exist, and I know what that looks like. So, but anyway, I'll stop there. I think this is a good idea, good first step, and there's lots of interesting models out there. Thank you.
Commissioner Green.
Thank you, Madam Chair. Let me ask a question first. I think, what is the outcome of this? Is the outcome a recommendation about what the governance structure will be, or is the outcome a recommendation about the process to explore various or an alternative governance structure?
Commissioner Fernando.
Yes, what I was attempting to resolve is that governance kept getting raised when we were seeking to advance other kind of operational desires. And so on the HHS board side. So since governance is with the county board, directing the county administrator, of course, not doing it by herself, but directing county administrator to kind of look more broadly at the last couple decades of the governance structure. I mean, for example, 8 of the last 10 years were negative balance. You know, that was not something that was communicated in that kind of manner until the last couple of years. And so analysis of how was the governance kind of the effectiveness of the governance relative to our goals. So this does kind of get to Commissioner Edelson's point. We have had a governance model. It has been working functionally, and clearly we are in a moment of need and wondering, is it the exact same governance structure? If so, why would it be that? Maybe it is exactly the same. Are there different models that we should be looking through? And then you all might recall a year and a half ago, maybe, at a HHS quarterly meeting, we did ask the administrator at the time to collect the past governance kind of reports.
Yeah.
And so there's just hundreds of pages of like governance in quotes, whatever that means. And so how might we assess that in today's climate? How might we assess that against the operational or financial effectiveness of the organization? Did the county get what it was desiring in that? So it does feel broad. I will admit to that. I will say though that the conversation at the dais was broad, and that I was attempting to reflect all colleagues' perspectives was the priority versus kind of picking and choosing. But again, we only have one more meeting, and I understand it's going to be a long one, but the last cycle is always a bit long. Like colleagues, I'm more than comfortable progressing it, and people can add to it if you wish. But I was hoping for a way to just begin with the objective of, because again, governance is actually meaning a lot of stuff to a lot of people right now, and I do know we need some sort of kind of shared understanding around how we are thinking about this subject. And so that the intent is for there to be a multiple perspectives and analysis of what has occurred. Multiple perspectives, that's that second resolving clauses, right? Ways to improve engagement with community, workforce, patients, clients, leadership, and elected officials. Just knowing that we are going to be in session advocating on behalf of this hospital and health writ large to stabilize and to make sure that, you know, that folks are getting the health access they need. And I believe that legislators will also ask us, what are you doing with governance? So that's really the intention to, you know, a lot of times we have to know a very defined scope in order to begin. And in this instance, agreeing on scope in order to begin, I didn't see as practical, just given the timeline of the year and the urgency into next year's calendar. You know, I obviously don't need to tell people with former legislators on this dais, but, you know, session is a continuation of the last session, which I learned about. And so there's legislators are already reaching out, wanting to know these types of answers. And this type of process can actually engage them in, well, what type of governance structure might be needed. So again, it's open-ended to reflect commissioners' collective perspective. Would be thrilled if it was prevailed today, but of course open to it being progress if colleagues would like to, you know, add to amend or add more of their perspective to the actual bar. Thanks, Chair.
Commissioner Conley. Oh, you have
I'm
another
sorry.
question?
Yeah.
Oh, yeah.
Sorry. May I? Is that
Please.
okay? Thank you. So thank you. That was super helpful. And I guess as I'm reading this and hearing the additional remarks, I have an understanding that this definitely includes an assessment of past structures and strengths and weaknesses thereof. I'm a little murky on whether or not this recommendations that would be provided by June 30th are recommending a governance structure. That question actually doesn't have to be answered for me right now, but I would like it, I suppose, soon. So I appreciate that we want to take a step forward in governance. I think it's a hugely important issue. There's, you know, we've had the meetings, as you said, piles of analysis. I appreciate that governance is going to guide the CEO search process, and so it feels like, yeah, let's take a step on this before we can really get to that. there are a couple things I'm more uncomfortable with. One of them is that this is not a criticism, it's just a sort of statement of fact. This came in as an addendum over a holiday weekend, so I'd like to come back with a little bit longer runway to understand what this includes. But also, like, I just can't let go of the fact that the last time that we did this, we as Hennepin County did this was 20 years ago, and it was a huge community process. And given the unique nature of HHS, and I would say maybe even more unique in 2025 than it was back in 2000, I think we really do need a process that has more input than this describes. And so my preference would be that we lay this over until January of 2026. And then these, what I think are pretty big questions about, like, well, what is this getting at, could be sorted out, and I could feel more comfortable moving forward.
Commissioner Conley.
Thank you, Madam Chair. I just wanted to add how I'm reading this, and for me, it's really kind of cut and dry, and I'll explain. And that's, I see two things happening, and that's, we do need to do the governance review, right? We do need to look at what worked, what didn't work, where are there areas that are needed for transformation, opportunities for improving transparency, all of those things. And then it also adds ways to improve engagement with community, workforce, patients, clients, leadership, and elected officials. So that's a report that's done by our county administrator that is, she'll be authorized to utilize internal and external resources to assist in the work. And then this report coming back, and that's the second part. The report, to me, is what gives us how we create that robust, community-driven process. So this is the bones that sets that off in the way that I'm reading it. This is the structure that sets off those next few steps from now until March, from now until June, that get us the foundation we need to create a governance model rooted in community, driven by, transparency, driven by lessons learned from past successes, lessons learned from what have been past failures, lessons learned from ways to be more transformative. All of the things written out in that second resolving clause will be worked on to bring us a product in March and then in June that allows for exactly, I think, what you're describing, Commissioner Green, and that is this robust way in which a new governance structure is created. So I see this as the first step to that. I'm comfortable with approving this today because I see it as really a bare bones structure in place to get to the next step. Similar to kind of how we were talking about the financial plan for 2026 this is a start. It's not gorgeous, but it gets us to the next step. We're at a space right now in time where we are actively, as Commissioner Lundy stated, having conversations with our legislators. People are interested in this now, and you mentioned this, Commissioner Fernando, and that having this direction to administration to start this review, I think is helpful. I think it is necessary. I think it should start now. And that's just because of the timing that we're in. But also, I'd like to see that review. Again, it's been 30 years. It's been a long time. And we're in a new space now, a new environment where we sit with the hospital. We've been talking about governance in a way that I think is grounded in future stability. So I think I'll just end with that. I see the two things here that stand out is that we are directing a review with the help of internal and external resources to examine all of these things in the second resolving clause, and then give us the tools that we'll need in March and June with that report containing the background and recommendations for that fuller, robust process that will take place. Thank you, Madam Chair.
So I'm going to comment before I go back around to my colleagues here. I just want to say that this is one of the things that I have been talking about. I know there have been some push to look at getting a new CEO, but I've always said we have to have a governance model well before we do that. We have to set this up right because we don't want to come in and have a CEO try to reenact and redo this. And, you know, we started that governance model back in 2000, and we may have outgrown that. You know, maybe that's why at the end we faced this financial crisis and a board that we were concerned could not move out of the financial crisis in a fast enough pace. And so there are a lot of other good governance models we should be looking at that are doing okay. I mean, nobody's doing fabulous here in this space, but there are some who are doing a little better than we are. And there's also some things that we might want to keep that we liked, but we're not going to know that until we go through and do all the analysis and everything. But I'd like to see those other governance models. And I'd like to have us then have a discussion about what we want some input then from a broader base. So I'm definitely in favor of looking at that. I'm going to go to Commissioner Edelson and then back to you, Commissioner Fernando. Commissioner Edelson.
I want to be very clear. I support this for the most part, right? But I think it's like a bill at the legislature. We just need to be tweaked. So I would support a progress today. And then I was just drafting up some amendments that I can either send you. I mean, and it was just clarifying. I don't think we should call it success or not success. I think we should add in a timeline because that's actually interesting, right? This is a first for me that we're the hospital board plus we're the county board and we're trying to navigate this. We're all trying to figure this out. I don't think anybody was on this county board when we were the hospital board before. We were in charge of it. So I think I would support a progress if somebody would like to second me.
Commissioner Fernando, I'll let the conversation.
Happy to second the progress motion. I just wanted to speak to timing, Commissioner Green. So we met as a governing board on the 18th, and that's when this discussion was most robust. And so I agree with you that it would be best for this to have not been an addendum, but there was, just to be clear, the conversation that I was seeking to reflect in the board action took place just on the same date as our last meeting. So wanted to express that. Thanks.
Commissioner Green.
Thank you, Madam Chair, and thank you for the timeline note. I will say, like, we have a hard time getting people to pay attention to what we're doing in this room, and it's even harder to get them to pay attention to the HHS meetings, although a few key people care a lot. I think, I mean, so I appreciated sort of the additional remarks that helped me see how my colleagues are interpreting this. And specifically, I'm going to call out and thank Commissioner Conley for your use of the word process. If the recommendations to be provided by June 30th are about process, then I'm comfortable. I was worried, and the way I interpreted this was the recommendations are about governance structure, and that I felt like, wait, I need a little more meat on these bones. But if, we absolutely do need to do a review, and I feel like I'm repeating things that you said, like if we want to do a review and that's sort of the content that informs recommendations on the process for picking a governance structure, I can be comfortable with that and would second a progress motion as opposed to punting to January.
I think I already seconded this progress motion to the last December 11th meeting, but what I will say, colleagues, if you could offer if you are bringing an amendment, that's fine, but you can offer just feedback directly to the administrator. Perhaps there will be an R1 is possible in a smoother manner for what will be our very last meeting of the year.
Yeah.
But again, it was just a couple weeks ago and we didn't have a meeting in between. You all might recall we just had such a robust conversation around governance, and HHS governance actually resides with the county board and not the hospital board, and just wanted to make sure that we initiated that in kind of the right spot.
I really appreciate that, and I know that conversation even came up at the finance meetings too. So everybody, I think, is talking about governance and how we move forward and how do we put this back together. So I think it's timely that you brought this to us. So was a layover motion, and there was a second.
I believe there was a progress motion for
Progress.
December 11th.
Progress and a second. Further discussion. All those in favor of the progress motion signify by aye.
Aye.
This item has been progressed. Okay. Now, this last item of business, and it's got a few pieces to it, is old business, item 3, which is the 2026 proposed operating capital budget. And for right now on this budget resolution, I would ask to progress this budget resolution, 250364. I'll ask for that,
Madam Chair,
please.
I saw an amendment.
Yeah, we're going to talk to the
13.
amendment next. We progress first.
Oh.
I've got the
Oh, my
the
bad.
motion is
Okay,
supposed to go.
that's-
Okay. Okay, second? All those in favor signify by aye.
Aye.
So we all know about the motion we need, this approval of Amendment 13. We got this. This was about the Gatsby. This is all technical stuff. So second now, I need a motion to approve the administrator's amendment number 13. Second?
I'll move it.
Okay.
Is that what you said?
She moved
Oh,
it.
sorry, second?
Oh, I thought you moved. Okay, so it's been moved and seconded?
I will move it.
Okay, so everybody understand the technical, the Gatsby 103, that was explained, excuse me.
Madam Chair, Commissioners, that the item needs to be before the body in order to be amended, so that I think the process probably ought to have been a move and a second on the progress motion, but not to take the vote until after considering the amendment.
Okay.
And so I think at this juncture, there may be the need for a motion to reconsider the progress motion to get it back before the body.
Okay, motion to reconsider.
Move we reconsider.
Okay, that was not in the instructions here.
Second.
Okay, so there's a motion. Would somebody like to make the motion then to progress?
I'm sorry, I think
We have to progress it again.
Well, Madam Chair, Commissioners, the motion to reconsider will bring the progress
Okay.
motion back.
Okay.
And
now
so
we'll
with the
discuss
with
this
the
item.
item
Okay.
before you,
All
then you can consider amendment.
Okay,
Now
next
I'll
time,
move
write
amendment
clear
13.
instructions on here, folks, next time. So a motion to approve Administrator Amendment Number 13.
I'll move that.
Okay, it's been moved and seconded. Any discussion on that? Everybody understands that one? All those in favor signify by aye.
Aye.
Motion carries. So then a vote to progress, the vote on the progress motion, so it's been moved and seconded. All those in favor signify by aye.
Aye.
Now that has happened. So I guess we have concluded that, and that moves to the next person, and that's the end of our business.
Yeah, break. Oh, my goodness.
Yes, we can take a break, right? Phew. Yeah, they got it. They got it here.
Yeah.
Well, Lundy is the next long one. His public safety is, your public works is nothing, really. I mean, winter kind of slows everything down, doesn't it?
Jody designates
Good afternoon, everyone. I will call to order our Health Committee on this Tuesday, December 2nd, 2025. Our first order of business today is to approve the minutes from our meeting held November 13th, 2025. Is there a motion to approve the minutes?
Move approval?
Second.
The minutes have been moved and seconded. Are there any corrections or comments on the minutes? Hearing and seeing none, all those in favor, please signify by saying aye. Aye. Any opposed? The minutes have passed. Item 2A on our agenda is a routine item. I'll ask for a motion to
So
bring
moved.
that before us. Item has been moved and seconded. 2A is an amendment, the fourth amendment to an agreement with Cotiviti, Inc. to provide CMS interoperability and patient access services to Hennepin Health. We're extending the end date to December 15th of 2030 and increasing the NTE by over $2.8 million for a new total NTE of a little over 3.6 million. That item has been moved and seconded, but Deputy Murphy, I would love to get an idea of the increased NTE.
Thank you, Madam Chair. Derek Woolrich is available to answer that question and provide some more background.
Thank you. Ms. Roach, welcome to the committee.
Thank you, Madam Chair, Commissioners. My name is Derek Woolridge. I am the Business Information Officer with Hennepin Health. So the resolution before you today is to amend our contract with Cotiviti, Inc. to provide CMS interoperability and patient access services to Hennepin Health. We're extending their current contract, like it was stated, the contract period through December 15th through 2030, and increasing the not to exceed amount by $2,841,231 for a new total not to exceed amount of $3,616,919. Cotiviti, Inc. was selected to provide CMS interoperability and patient access services in 2022 as a result of an open competitive RFP process. CMS interoperability refers to the Centers for Medicare and Medicaid Services efforts to ensure that health information can be securely and efficiently exchanged across healthcare systems between patients, providers, and payers. Cotiviti has worked with us through the first phase of CMS interoperability, and this move will allow us to move to the next phase. The goal is to enhance interoperability across healthcare systems, reduce administrative burden for providers and payers, improve patient access to their health information, and to modernize prior authorizations. This board action request aligns with Hennepin County disparity reduction efforts to improve access to culturally specific sensitive health services and increase community well-being. When completed, members can access their health records more easily through third-party apps. They can take their data with them when switching health plans, and this empowers members to make more informed decisions about their care. I'll pause here and take any questions.
Thank you. I appreciate that background. I'm going to assume, and please correct me, that because we're entering into the second phase, is that the increased NTE?
Correct.
Got it. Thank you so much. I appreciate you being here. Colleagues, any questions or comments? Seeing and hearing none, all those in favor, please signify by saying aye. Aye.
Aye.
Any opposed? That item passes, and that concludes our agenda for today.
I will call to order the Human Services Committee. It's Tuesday, December 2nd. It is 4 p.m. I'm the Chair, Heather Edelson. Our first order of business is to approve the minutes from November 13th. May I have a motion, please?
So moved.
Second.
Thank you. It's been all those in favor, please say aye.
Aye.
Opposed? Motion carries. We have one routine item before us today and 3 addenda before us. If I can have a motion to, I'll move 2A before us. If I could have a second.
Second.
Thank you. It's been moved and seconded. Item 2A is the Human Services and Public Health Resolution, including contracts and amendments to contracts with providers. More information is outlined in the Human Services and Public Health Contract Report 2517. Are there any questions on this? All right, being no questions or comments, then we'll go to a vote. All those in favor of approving item 2A, please say aye.
Aye.
Opposed? The motion carries. And we'll move on to the 3 addenda that we have, items for discussion and action. If I can have a motion to move as a block items 2B through 2E before us, I will read them into the record.
So moved.
Second.
Thank you. It's been moved and seconded. Items 2B is an amendment to an agreement with the Minnesota Department of Services for a grant for the state's long-term homeless supportive services fund program as a part of the Human Services and Public Health Long-Term Homelessness Initiative, increasing the receivable amount to $4,251,451. Did I get that right?
You did.
Oh my goodness. Yeah. Okay, good. I was like, it's been a long day. For a new total amount of $15,508,657 and extending the term to June 30th of 2027. Item 2C is an amendment to an agreement with the Minnesota Department of Human Services to incorporate language changes to Clause 3, consideration of terms and payment, Subclause 3(1)(a)(2), budget modification, and the receivable of amount of $3,500,000 for the period of July 1, 2025 through June 30th, 2027 remains the same. The grant will support Hennepin County's HSPH's operation and support services for the multi-site family overflow shelter program. Item 2D is amendments and agreements with the 10 cities for the services of Hennepin County embedded social work program.
Madam
And-
Chair,
Yes.
just want to note that there's a update that needs to be made to the amendment number
Okay,
for item 2D.
okay. And what is that, Mr. Murphy? Is
It should read, the amendment number should read A2412472.
Perfect. Thank you so much. And so item 2D will note that amendment. And then item 2E is an amendment for a JPA with the City of Hopkins for participation in the 911 alternative response team, extending the end date to December 31st, 2026, and increasing the receivable amount to by $88,431. There being no further, actually with that, do you have any questions? We moved and seconded. I know it's been a long day. It was moved and seconded. Do we have any questions on this? All right, with that, no questions, so we'll move to a vote. All those in favor, please, of approving items 2B through 2E, please say aye.
Aye.
Opposed? The motion carries, and that concludes the Human Services Committee. We are adjourned.
I'd like to call the committee, Law, Safety, and Justice Committee to order. Today we have a few items. We won't be as efficient as the Health and Human Services, I'll just warn you up front, but we'll do our best. First item is approval of the minutes from November 13th. If I get a motion, second.
Second.
We have a motion and a second. Any changes, additions, corrections? Seeing none, all those in favor say aye.
Aye.
Opposed? Motion carries. We have a few items. Got a couple groupings, but pretty much one by one. First up, can I get a motion for 2A?
So moved.
Second.
2A is 9 agreements with local government agencies to provide work crews from the Sentencing to Service Program. Various contract dates, total receivable of $1,027,481.76. Any requests for background? Seeing none, all those in favor say aye.
Aye.
Opposed? Motion carries. Next item is 2B, if I can get a motion and a second.
So moved.
Second?
We have 2B is an amendment to agreement with Ren Collective, provide complex legal communication services, extending the end date 12/31/26, increasing the not to exceed by 60,000 for a new total not to exceed of 210,000. Can we get background, please? Jala.
Chair Lundy, Commissioners, I'd like to invite Morgan Coons from the County Attorney's Office to provide background on this amendment.
The mic, can you put the mic on?
Chair and Commissioners, thank you so much. I'm here covering for Sarah Davis, who was unable to be here and apologizes for that. I could restate what's in the bar if that would be helpful, or I could take questions. The brief summary is that the Ren Collective helps the Hennepin County Attorney's Office with its communications with the public about very complex legal matters that come before us.
Any questions or comments? Commissioner Anderson.
Thank you. Are there communications? I know the county has a communications team in-house. Is there, do we have agreements with the county to utilize those? Like, is there a specific reason that we have to use outside services and contracts, knowing that, as we've mentioned in other settings, we're shaking all couch cushions at this point, so.
Yeah, absolutely. So the county attorney's office does have several communications folks on staff. We have one main communications person that deals with the bulk of our communications with the press. We also have another staff member who helps with digital storytelling and communicating to the public using digital means. And then we bring in some staff from our community relations team to help augment that. The problem is that we would need a professional level communications person to be able to replace the work of the Ren Collective. I know that we collaborate often with larger Hennepin County communications office. I would defer to Ms. Guzman to inform us if they would have capacity to help provide these services. It's been my experience that they don't always have that capacity, and that I believe the Hennepin County Attorney's Office sort of has unique issues, and with Mary Moriarty being an elected official, needs to be able to communicate to the public using her communications folks.
I would love to know capacity.
Chair, Commissioners, Commissioner Anderson, in addition to the staff that are in-house at the County Attorney's Office, we do have communications staff that the county helps to support. We are a liaison to that office. You might be aware that where there are vacancies in the elected offices, we oftentimes help in a temporary basis to help support and ensure that we are timely in responses to media inquiries and the like. So we do not have staff to offer and augment, but we can in a temporary occasion when there are vacancies. But as Mr. Coons has identified, there are a number of staff already assigned in the County Attorney's Office that provide multiple services and supports, including videography, which we've seen, and it's of great quality.
Commissioner Edelson.
Thank you. And so I'm going to just be honest. And the last time we approved this, my community, I got so many emails in opposition. But I very clearly stated, and I think it's my position still today, is this is within her current budget, is this not?
Sorry. Chair and Commissioners, yes, this is within the current budget. And the other thing I will add is that we have significantly reduced the monthly spend. I think last year it was reduced by 50%, and now we're reducing it by another 33%. So we're very aware of all the fiscal issues, and we're being conscious of that. The amount is currently significantly reduced from what it was in past years.
Okay, thank you. And I will just note, my community was strongly opposed to it before, but I will support it because it is currently within her budget, and that's the current spend. So thank you.
Myself, I will not be supporting this. Let me just read the Ren Collective, just so we're all on the same page. First, this is theirs. democracy under attack, the resurgence of the death penalty, an honest conversation about public safety, the president's plan to lock everyone up. Our future is on the ballot. Using criminal prosecution to manipulate the 2026 election. The end of accountability. Trump's longing for the days of Jim Crow. The Rent Collective is not a PR firm. They are an advocacy group. And the fact that we're using taxpayers' money for an advocacy group, before I was told this was a PR thing, I thought, hey, if you need PR help, this isn't a PR group. They are here to advocate. I am also looking at the bar where twice in 3 sentences there's complex information, like as if we can't understand information. We can understand things. People can have differences of opinions. In the second sentence is a broad public misinformation campaign. To me, this is nothing more than advocacy. Taxpayers should not pay for it. If Ms. Moriarty wants to pay for it, they use campaign money, because that's what this is. It is not good use of our services. We don't have the money. If we need help with PR, we have people who can help or we can hire, but the Rent Collective is not a PR firm. If you look at their website, I don't think I found anything that actually said helping with press. They are a narrative driver. They're here to push an agenda. The fact that we're paying using money has a lot of people upset. That's where I stand. This in no way is a PR. Absolutely. I'd be happy to support a real PR firm. This isn't one of those. Any other questions or comments?
I do, Mr. Chair.
I'm sorry, Commissioner Conley.
Thank you. So that begs the question. I'm looking at their website too. How did you go out for the bid to find the communications that you would use for the complex legal issues? Because I too don't see there's a lot that they do, but I don't see like contracted media work for government agencies. So can you talk to me a little bit more about the process to obtain REN to do this work for you?
Chair, Commissioner, and other commissioners, I was not involved in that stage. I believe the Wren Collective has been working with the Hennepin County Attorney's Office since probably the first year of Ms. Moriarty's administration, so I'm not familiar with the background. We would have to get you additional background on that. I will say that in my experience working with them, it is communications work. The work that they do is helping to draft press releases, helping to let me look at my notes here. Helping to draft communications materials, helping us respond very quickly and clearly. They provide a lot of information about things that are going on nationally and how other county attorneys' offices are dealing with them and how that will impact our community. There's been some examples just today recently of national news stories coming out of DC where disparaging things are made about folks in our community, and that has a really significant impact on the public, on how our office relates to victims of crime, on how our office handles it. And so working with a firm that has that national perspective, has that professional level communications experience is really important. And if we were gonna hire someone, it would cost significantly more than the current ask of this contract.
So just as a follow-up, Mr. Chair, I would very much appreciate learning how this went out for bid, understanding that hiring a person is more expensive, but typically these are types of, these go out for bid and then we select the best one, right? So I'm gonna assume it went out for bid. I'd like to know what that process was like. I do understand that even today, my phone is blowing up about some pretty terrible things that will happen to a large group of people who live in my district very soon. And so that's going to need some very complex community relations or media stuff. So Ms. Guzman, I think my question, I will support this today, given the history that it already has with, this is an amendment to an agreement, but I would like to get some background on how we went out for bid on this. And again, this is within our county attorney's purview, considering it's her budget. So I don't have a problem with that. I'll be supportive, but the background will be very helpful for me in understanding this. Thank you.
Any other questions or comments? All those in favor say aye.
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 Opposed? Aye. Nay. I'm sorry.
You said aye.
Oh, wow. Nay.
Chair, can we just do voice or committee roll call?
Yeah, let's do roll call, please.
Commissioner Fernando,
Aye.
Commissioner Green. Aye. Commissioner Conley,
Aye.
Commissioner Gotell,
Aye.
Commissioner Edelson. Aye. Commissioner Anderson. No. Commissioner Lundy,
No. Motion does pass 5-2. Thank you very much. At this time, move on to 2C. If it's okay, I would like to group 2C and 2D together. See no objections. If I get a
I'll
motion in a
move
second.
both, Chair.
We have a motion to approve 2C and 2D. 2C is an amendment to Corner House Interagency Child Abuse Evaluation Center for assessments of child sexual abuse victims and expert witness testimony. Extend the end date of 6/30/26 and increasing not to exceed by $133,000 for a new total, not to exceed total of $1,346,319. 2D is an amendment to 6 agreements to local agencies to provide victim advocacy, legal representation, and intervention and prevention services for cases handled by the Domestic Abuse Service Center and Hennepin County Attorney's Office. Extend end dates to 12/31/26 and increase combined not to exceed amount to $2,326,274. Is there any questions? Commissioner Fernando.
Thank you, Chair. More comments. I'm very, very supportive of this work. I am a bit heartbroken about why the need continues to grow with respect to victims. And I've always expressed that I wish for, at some point, the county to have a parallel path with respect to its victim services. This is housed within the county attorney's office and DASC, for which we are very grateful. Oh, there's members here. Hey. Thank you for your work. Thank you, thank you. And so I'm just very, very supportive of the work. I am appreciating that the number is going higher and that we are supporting it, but it is heartbreaking to read about the statistics and the inaction persisting over decades, specifically for domestic violence victims. And individually, just colleagues, I know I've already said this, but so much of DV funding and a lot with children is federally funded. And so I individually, and appreciate that was a unanimous vote a couple months ago now. This is a public health need from my perspective. And when we're talking about people who feel like they must stay in their scenario in order to survive, and then they're not getting the same type of holistic support from government at large. That's a dynamic that I know many of us care about. So I want to express gratitude to the county attorney's office and to DASC, but then also renew my public commitment to ensuring that victims, specifically domestic violence and intimate partner victims, are viewed through a public health lens and are funded as such. Thank you, Chair.
Thank you, Commissioner Conley.
Thank you, Mr. Chair. Thank you for those comments too, Commissioner Fernando. I could not agree more. It is just devastating. I wanted just to get some clarification on the local agencies that we are increasing the NTEs for. They're very culturally specific, but I don't see any organizations targeted to African American and Black communities that cross the diaspora. And I'd like to know if we do have agencies or organizations that we contract with that really focus on Black and African American women and any victims, survivors. Because I just don't see, the organizations are very well defined in the background, but I don't see any with a specific focus on, say, Somali American women or African American Black survivors or victims. So that's a question. Do we have contracts with local agencies, or the amendments just to these 6? Talk me through that, please. Thank
Chair
you.
Lundy, Commissioners, Commissioner Conley, I'd like to invite Siri Logansgaard to provide background and to answer more directly your questions.
You need the mic on.
Madam Chair, Commissioner Lundy, Commissioners, thank you for having me today. My name is Siri Lokenskard. I'm the Director of the Domestic Abuse Service Center. To Commissioner Conley's question, currently we do have an African American grant under OJP, which is Office of Justice Program, to serve primarily the African American community along with all victim survivors of domestic violence. Commissioner Conley, to your point, last year alone in 2024, and I apologize, I don't have statistics for 2025 yet, but in 2024, we did serve around 1,609 individuals who identified as Black and African American. And so the need is there. One of the supports that we are able to offer and provide through our African American grant through the Office of Justice Program is financial assistance. That is primarily financial assistance for individuals who have experienced domestic violence where there are high lethality and risk factors in their situation. And those financial needs go towards assisting with safety planning resources. And that includes financial help with relocation, safe housing, transportation, lock changes, security systems, et cetera. Anything that could benefit victim survivors in assisting with their safety plan. But you are correct, we don't have an agency specifically.
Yeah, so I was going to ask, I'm just looking at some data from a couple of years ago that just said Black women are 7% of the Minnesota population, 40% of its domestic violence victims. So there's a lot there. And there's a couple of organizations that just popped up when I just typed in, African American domestic violence Minneapolis, right? There's there's an organization called Fumulani, Minnesota African Women Against Violence that serves women from Africa. I'm just wondering if we can maybe look at what local organizations or agencies might exist that serve specifically Black women from across the diaspora. So whether that you're born here or born in another country and come here, there's got to be an organization that works specifically with those survivors outside of that, because I'm familiar with the OJP grant, but this work is so detailed and comprehensive for domestic abuse survivors and victims that there's got to be an organization that is culturally specific to African and African American women that exists that we can partner with to have in this list of agreements. So just something that I hope that you look into.
Thank you.
Thank you.
Any other questions, comments? I just was going to ask a similar question with African immigrant communities. I'm more familiar with nonprofits in the Brooklands and Crystal New Hope that aren't connected, but they're offering services. They're trying to find support. They've tried to raise money for a house. Many times, AMWAG comes to mind as a group that has done that. But they're always operating with a shoestring budget, and they're using community resources to help shelter females and males, because that was one of the things they were talking about is the immigration comes in when the victim is, and so that complication comes into play as well. So what I was going to ask for, and I don't know if I know we've had conversations up here, is maybe next year if we could get a briefing, find time on the calendar. I don't know. I would defer to that to Chair Fernando, but to kind of have a conversation, because I'd love to learn more. I remember in Brooklyn Park, we had our city prosecutor was settling all the time, and there was a desire to have more aggressive. And so we partnered with Cornerstone. We brought advocate in-house to the department to gather information to really capture that first few hours information, because people become more reluctant. And the numbers grew because we're actually getting closer to the real number. And so I think we're more successful. I expect that number's going to grow, not because it's worse, but because we're actually seeing what is already out there. So that is my belief, and I would defer to you on that question. But I do think this board is really interested in understanding more about this relationship and how we can plug in better. So I'll stop there and let you respond.
Oh, absolutely. I agree. I think we are always looking to see how we can expand and better serve the communities that we are in contact with. And I agree with you, Commissioner Lundy. I think that domestic violence is pervasive, and I think it's not, our numbers have increased. And is that a matter of us increasing access, or is that a matter of, domestic violence, becoming a bigger public health crisis? And I think it's both. It's both accessibility and just being more accessible to the communities that we serve. So I agree, and definitely something that we can look into for the 2026 year.
And thank you for that. And I think, having sometimes broken some of the crime data into categories, in the suburbs, you'll find that domestic abuse cases are some of the highest calls. In fact, I believe, and I haven't looked for about a year, so I'll defer to that. Maybe I'm wrong here, but it is the highest in every one of my 6 communities, and I'll wager it's the highest in every community. And so when we talk about crime, and people are always on the news and social media worried about something, but there is one number that is much bigger than the rest, and people never, I shouldn't say never, that's not fair. They talk less about that, I'll put it that way. So, okay, thank you. Any other questions or comments? See none. All those in favor of 2C and 2D, say aye, please.
Aye.
Opposed? Motion carries. Next, I have, if it's okay, I was looking at, well, actually, let's just do 2E. It's a routine item. If I get a motion, a second, please.
So moved.
Second?
2E is amendment to agreements with local agencies to provide adult diversion services to the Hennepin County Attorney's Office, extending end dates to 6/30/26 and increasing combined not to exceed amount to $2,411,307. Any questions or comments? See none. All those in favor say aye.
Aye.
Opposed? Motion carries. The next two I think we should keep them separate because I think we have some people here who might want to have specific questions. So first, if I get a motion in a second for 2F.
So moved.
We have a motion and a second for 2F, which is an amendments agreements with 8 adult representation services, ARS, legal representation contracts for 2026. Does anybody want any background or have questions? Commissioner Fernando.
Yes, I would just always love the opportunity to thank our adult representation services internal staff, as well as these kind of external community providers. And in a time period where due process is not always reliable, we are very grateful for your service. Thank you, Chair.
Any other questions or comments? Seeing none, all those in favor of 2F say aye.
Aye.
Opposed? Motion carries. Next, we have 2G. If I get a motion in a second, please. 2G, to read the record, is an amendment to agreements with the Metropolitan Emergency Services Board, Alina Health Systems, Hennepin Healthcare System, the City of Edina, the City of Minneapolis, and Hennepin County, establish a relationship between and among the parties for the procurement of components to support shared emergency communication services. I was wondering if we could get some background, please, Jella.
Chair Lundy, Commissioners, I'd like to invite Major Michael Jurdy to provide background on this item. Oh, or Tony Martin, pardon me, Tony Martin from the Sheriff's Office to provide background on this item.
Thank you, Ms. Guzman. Mr. Chair, members, commissioners, thank you for the opportunity. My name is Tony Martin, Emergency Communications Director with the Sheriff's Office. Some background, back in 2014, all of these entities went into an agreement to purchase a shared 911 system. So we are operating on the same platform, using the same data centers, ultimately just satellite locations. With the shared system, we're going to continue to operate separate 911 centers. However, this amendment is going to be adding Bloomington and Eden Prairie. They have both expressed interest. In essence, they're going to still operate their own centers. It's just going to be joining onto our shared system data centers and that. So stand for any questions.
Any questions or comments? Commissioner Fernando.
Another comment. I'm very grateful for you, Director. And it is really important. Commissioner Anderson and I both serve on the MESB. Regionalism and resilience among our systems in case one system needs a backup for any reason has been an important discussion for which Director Martin has been a key contributor. So I wanted to thank you for your work and express my support for this action. Thanks, Chair.
Commissioner Edelson.
Very supportive. I'm curious, Mr. Martin, if, first of all, let's just say the city of Edina rocks because we were like the only city, like the suburban city that was in there initially. Now Bloomington and Eden Prairie are joining. And then remind me, Mr. Martin, where did you start your career? Was it where?
I did start in the city of Edina, so
Yeah.
I was a part of this initial, the little plug there. So I've been a part of this since day one.
It's been a long day. But really a question is, because we're getting more cities in, are they able to share data easily? Like, is that something, because I know that's been an issue with just, trying to share all of the access to data.
So I appreciate your comment, and I would say that's in a completely separate platform. As far as when we deal with our systems, we have our radio, we have our phones, and we have our CAD. CAD, we have a lot of different initiatives going and a lot of other projects that we're trying to get that shared data, to get that shared access. Can certainly provide some information down the road, but we're trying that. As far as this and the 911 system, it's not necessarily data, but it's under the same umbrella. And so I'm going to give you a small example. During COVID, HCMC, Hennepin Healthcare, had to split their center because they're in a very small center. They utilized our backup center, just logging into the system. They didn't have to do anything different because I could go log in at one of these other centers and I could just answer calls for whatever entity. So I would say on a redundant platform, this is just, it's helping with the redundancy, especially during certain events, et cetera. So this would be a separate, but under that same. And it is a cost savings because we are sharing and decreasing the data center costs amongst each other. So it'll be a cost savings for all the 5 current and then also for the 2 additional.
That's great news. Yeah. Okay, thank you.
I just had a comment. Since I can't run, I'm just going to limp across like 8 landmines all at once. I don't know if everybody saw the letter from former Commissioner, the Star Tribune, about the need for governments to rethink how they deliver services, pulling things together. I think governments, you look at the property taxes, we're going to have our tooth tonight. I think this is our first of 3 bad budget years, and it's going to be easiest because it's easy to cut empty positions. It's easy to cut stuff. But the next year going to be tougher. That I do think it's active and imperative for all of us to look at how we deliver services. My impression as mayor, no one ever called and said, "Dang it, why did Champlin Fire Department show up at my house for a fire?" Never happened. They don't care what ambulance shows up. They don't care what they want as professional people in a time of need. You're the delivery mechanism. I do believe it's time for our PSAPs to unify under a system, because as we go forward, the computer systems are going to become more expensive. We're going to have tougher time staffing. It is, I think, one of those moments. Tomorrow, no, but I think what the work we're doing to have systems that are common lead us down a path where a city doesn't have to go, crap, we can't afford this upgrade, and now we are orphaned. So I applaud you and the rest of the system, but I do look at one of these as just, it is an opportunity. It's not to say that things are going to be different or less or better. It's just, when people call 911, they ain't calling because things are good. They're calling because they want the best person on the entire planet to arrive at their place the fastest possible moment. And the rest of it's all just decorations. They want the best. And so the best is the one who arrives first. It's my experience. So I just wanted to say that I support this. I do think it's along many things that we should look at a lot of things. I think other things, since I'm already in the minefield throwing things around, police departments. We have, I think, too many. I think we have people that are struggling to keep things staffed. That's a reality. We're not creating new police officers. We're just stealing from each other. That's how the system's working right now. So that's just my belief. It'll come. It's going to be because of money. Eventually, that is how everything happens. Yeah. So, any other questions or comments? All those in favor of 2G, say aye.
Aye.
Opposed? Motion carries. And with that, the Law, Safety, and Justice Committee is complete.
I'd like to move to A. Kevin, I'd like to move to A.
Public Works, don't worry, I'll keep this to a half hour.
Well, dinner time. Oh, this is another one? Or is this the same one? I got it.
I will call to order the Public Works Committee for today, Tuesday, December 2nd, 2025. Our first item on the agenda is to approve the minutes from our previous meeting. May I have a motion and a second?
So moved.
We have a motion and a second. Any additions or corrections? Hearing none. All those in favor say aye.
Aye.
Aye. Any opposed? The minutes are approved. We have one routine item. May I have a motion for this?
So moved.
I will second. The item 2A is to negotiate an agreement with Richfield for reconstruction of Nicollet Avenue, estimated county cost of $32,410 of state aid, with an estimated receivable of just under $8 million. This is advancing a construction project that we have long been working on. Do you have any questions or?
No, can I just say something if I may, Mr. Chair?
course, yep.
I just want to say that, this is about the city participation. And I know it's been really hard for not just the city of Ridgefield, but many cities to bring in their cost participation. And I know that county staff really sharpened their pencils on this to try to get this more in line for what they can try to do. They're also on the bonding tour, hoping to get bonding money to put into this, and I just want to thank the staff for the work on this. I know we're looking in the future about cost participation as a general and looking at our policy, but this is a good place, and this is where the conversation started, so I'm just appreciative of where we're at.
Thank you. Any additional questions or correct? Hearing none, all those in favor say aye.
Aye.
Any opposed? That item is approved. We have an addendum. I'm going to move the item 2B, an agreement with the city of Minneapolis for waste delivery during the period of January 1, 26 to 12/31/27. May I have a second?
Second.
You have a second. Commissioner Fernando, I know that you had
Yes, colleagues, I'm aware of the time, so I understand if, we want to progress, et cetera. But this item got separated from the previous action because of my own amendment. And it's because I wanted to be able to vote on something favorable for the city of Minneapolis residents that has Minneapolis policymakers also weighing in on this request. This is a very peculiar tension, in my opinion. Minneapolis policymakers have all expressed a end of incineration date that is the same date of this agreement, the end date. And they have expressed a decommissioning, a full closure of the Herc facility, which is inconsistent with our plan. I've not been able to attain anything different from that in writing in the last year. So my understanding from staff is that Minneapolis Council has not yet looked at this action, and so that's what was tough. I wanted this to come back before us, hoping that the city would have taken some sort of action in the interim. Since that wasn't the case, I wrote a resolution that I'm comfortable voting in favor of. I'm not comfortable voting in favor of the waste delivery contract as is, which is why I invite progress if that's preferred, because there's a complete conflict with the operational requests from the city and the policymakers' verbal commitments and published statements and voted record. So for me, that's just distinct from the 74 other contracts. No other user of the HERC has passed a resolution that is so inconsistent with our plan and, quite frankly, in some ways, their own plan. So I get if we want to punt it or something, but I wanted to be able to vote in favor of something today. And that's why I attempted to draft more concretely. Just again, for me, it's peculiar that the city of Minneapolis's policy position is so distinct from their operational requests. Thank you, Chair.
Thank you, Commissioner Fernando. Commissioner Conley.
Thank you, Mr. Chair. Thank you, Commissioner Fernando, for bringing this ahead of us. You know what? I am still, and I think I mentioned this when the hauler agreements came before us the first time, was that we do have cities of the first class. And the one in Hennepin County, because there's only one, does have a legislative action on record that says that they want the HERC closed and to cease incineration. So again, there's contradictions there, but I think that this is a bar that makes sense. In addition to that, I'm also thinking about the zero waste policy we just approved with the amendments that I made to the cities of the first class so that we can get some better reporting, because this isn't just about the city of Minneapolis not bringing trash to the HERC by 12/31/2027. They don't necessarily have a path to get to that, according to what we saw. But we have a policy in place now that can hold them accountable as soon as February. And so that contradiction remains. Again, this is the only one of our 45 cities who has a legislative action that is outlined in the second resolving clause in red here. So I would be supportive of this today. I think it makes sense. It doesn't change the hauler agreements to our other cities. And it's actually asking for clarification from the city as to what it exactly is that they want to do. Because right now, they've got one thing on record, but contradicts something entirely different, and doesn't align with the zero waste goals that we've seen them present to us. The structure does not exist at the city of Minneapolis to reach accelerated zero waste. So having a resolving clause that actually calls that out and asks for the clarification is what is really what the power move that is reason why I support this. It is late, my bad, but is why I support this as is. Thank you.
Thank you. Any other, yes, Commissioner Edelson, and then I have some comments and thoughts on this, but.
Okay, well, first of all, I just want to start by saying I'd like to make a motion for progress here. And I don't know if I have a second, but I'll give it a second. I guess I'm just seeing this and reading this, and there's huge implications for us closing the HERC without a plan. And I know that that's not exactly what this is doing, but I'm just trying to, there's so much going on today that I don't feel prepared to fully understand exactly what is A2513181. Is that our agreement to the city of Minneapolis? I guess that's a question for Commissioner Fernando.
Yeah, so, and just to be clear, I'm happy to progress this. I was trying to have an action today that I could vote in favor of as a Minneapolis resident, because, so the red is what I added and the black is what was provided, right? So this agreement, A2513181, is the agreement between us and the city that staff is proposing that would establish an $85 per ton rate versus the $150 per ton rate. Waste could still be delivered to the HERC at the 150 rate without a contract. This establishes a reduced contract rate because we've created this agreement. Again, my wrinkle in this is we have not received any formal policymaker communication or request regarding this agreement. I don't even know how they would, I mean, it's not in front of their committee, I think, until this Thursday, and not in front of the full council until next week. And so I'm aware that city staff have asked our staff, but as policymakers ourselves, my own policymakers have said, well, we don't agree with this. And so I wanted to create some space for the policymakers to clarify their position on behalf of their organization, their entity. But I get that it's a bit complicated. And so I'm happy to have it be progressed, but I just can't express enough. As presented to us, establishing rates through 12/31/2027. But the city of Minneapolis's resolution states the end of waste incineration no later than 12/31/2027, the same date, and the entire facility by December 31, 2033, which is in direct conflict with our Reinventing Solid Waste Plan. So I want to pass something for the residents of Minneapolis, including myself, for continued services, and I am eagerly awaiting some amount of policymaker clarity around what their intention is as the land use authority, as the individuals responsible for organized hauling. So I'm this does not have to be today, but if people really wanted to pass this agreement today, I wanted to offer language that would allow me to ethically and like morally kind of be in favor of that as both the resident of the city. So again, I'm not, it's a lot of money. I mean, it's 40% reduced rate with a contract amount. So I wish for some sort of smooth operations to exist. And it is peculiar for me that we don't have this clarity from policymakers when they passed the resolution a year ago. So obviously, we're aware that this has been a very tenuous community subject. And that's the other aspect here. You've all heard public comment. People are saying that we're the only ones that are kind of in the way. So I will second a progress motion if that's where we're at. This is just so odd
Not
to have such a
just yet.
distinction.
I know Commissioner Lundy and Commissioner Guttal, and then Commissioner Green. Yeah.
Just
Thank
make
you.
sure. I'm going to vote to progress that. I'm not saying I'll vote at the end. I just want to, I think progress in it is, I'm fine with that because we'll have more discussion. I could do some more study. And so I'm good with that part. So I just wanted to be honest. I'm still kind of like 50-50, but I see the value and continue that. My one question is in my second month of mayor, I thought it'd be a really cool idea to take on organized waste hauling, which anybody who's been through that process will.
Yes.
Yeah, it was a spectacular way to start off my time as mayor. So I was going to ask our new county administrator if to reach out to the city managers in the suburbs, because the last time we talked about the HERC and we asked for feedback, we got feedback and it was not the same. And I feel like to not go back out, and I realize this is just for Minneapolis, but things that just happens before one tends to get applied to others. And I'm not saying that's the intent. I just know how systems work. Once you have it set up, it's easy to say, second tier starts at 75,000, and then pretty soon so I do think it's important because we did go out and we did get some feedback and it was not at all supportive of what we were trying to do. And I think to not go back out and ask the suburbs, even though I know this isn't game to them, they're all going to have the same worry that I do, which is, okay, you're going to apply it to us. Like, I can write, I know my city managers, that's exactly what they're going to say. So I think it's worth that. It is a countywide thing. It is lots of people. I can tell you, I wouldn't lose an election by saying I didn't support shutting the HERC down in Brooklyn Park, because I've knocked on doors. I know what people think. And that doesn't make it not the right thing to do, but we have got to engage with the city managers, the city councils, to start to talk about where are we headed, not just about this, but the whole system. And I don't think people have that, that knowledge about where it is, because I'll just say this, in the suburbs, trash don't get picked up. Trust me, every city council member gets a call. It can't be more simple than that. And not one person, not my wife, not any of my neighbors will ever care about where it goes. They just want to know why the heck that trash is still sitting at the end of my driveway. And I'll just apologize to Mr. Rogan. Robbinsdale had the month-long thing of no service. So anyway, I'll stop there.
I'm probably going to continue some of this because I have talked to my cities and I regularly talk to my cities about the HERC and the solid waste program and our zero waste initiatives. And I know that some of my cities are performing better than others. And there are those conversations that are going on. And I'd let them know that I know about either they're really great goals or some that need a lot of improvement. And so I have those conversations around this, but they're all trying to step up. But even the cities that don't contribute to the HERC, they are concerned about the HERC closure because they realize what will happen to their residents' garbage when it closes too. I think this is specific to Minneapolis, and Minneapolis has brought up something very specific to us. And I think one of the things I want to say is when we do something like this, somehow they seem to be listening to us for a change, and they actually respond then. The last time we looked at an initiative around them too, and you brought in R1, we got communication back finally. I think this is a really hard tool to have to use, but I find that I'm not getting communication from Minneapolis either, and I do represent Minneapolis as well, and they don't talk to me about this. And I don't see them reaching out to me to talk about this either, and I can tell you that they do reach out, and I do talk to representatives and city members of the other suburban cities that I work with. So it will get their attention, hopefully, and they'll sit down and start talking with us more. We really want to work with them. We really do, but I'm not finding, we're just having a hard time finding a path forward for some reason. Seem to be some challenges there. So I would be supportive of something like this or similar.
Commissioner Green.
Thank you, Mr. Chair, and really interesting hearing people's remarks and taking it all in. I feel like I benefit now from maybe speaking last. So I would say generally, I'm not a huge fan of sort of needling our partners in this way, let's say, comma. However, I really feel exactly what you've described here, Commissioner Fernando, with the incongruity between what the city is, how they're voting, and then what they're sort of asking to contract with us on. Additionally, I realized as I was listening today, like, oh yeah, it was this county board that wanted to expand. I'm sorry, not this county board. It was the Hennepin County Board at the time that wanted to expand incineration at the HERC, and Minneapolis said, no, you may not. And then Hennepin County said, okay, if we don't, then you've got to offer curbside recycling. And that's how we have curbside composting in the city of Minneapolis. And I think that was a win for city residents. So I'm thinking of that as I consider this. I support the progress motion. Just for the sake of transparency, if I were giving you odds today, I'm sort of a 60-40 yes. Yeah, thanks.
Thank you. Before second rounds or third rounds or whatever, what is, just clarifying process right now, the original item is before us, not the Commissioner Fernando's R1, with discussion of potentially progressing. My personal opinion on this is, like, our part in this is to handle the garbage that is coming to us through agreements that we have with cities who sign an agreement with us. And the other 40 or however many, 36 cities, the 44 that have an agreement for this, I think it's less than the 45, whatever the number is, they will be approved. If the city of Minneapolis chooses to approve or not approve, like, your policymakers can say, no, we don't want to approve this, and then they will go to the other rate, and that's a choice that they get to make. I am not in favor of closing the door on that possibility. I view our job as to be consistent with our policy of, we will continue to work on zero waste policy. We will continue to engage with the city of Minneapolis to implement fully a zero waste plan that gets us to a point where we can close down the HERC. The city of Minneapolis can make a choice to not approve the agreement that's coming before them Thursday or sometime in the next week or two. And that's a choice that they get to make. And that's not a choice that we have to, it's not a choice for us to dictate to them, I guess, in my opinion. I view us as the facilitator of having this agreement created and for them to accept it or not accept. And then they get to make their choice. And then we'll deal with it in that way. So a progress doesn't change the execution date, and I would support the original language at whatever point it comes before us, before the end of the year, so that if the city of Minneapolis chooses to vote in favor of this, they have made that choice, and then we will have that executed agreement. in the end, they still have to engage with waste hauling in the way that Minneapolis residents demand of them. Just like every other city, Commissioner Lundy, you made the point of if trash don't get picked up, people are going to call. And, I have a call into my organics collection because it didn't get picked up this week and I'm mad. But, it's like, this is what's going on, right? That's up to the city, not us. So I understand that there is a progress motion or an appetite for a progress motion. I would entertain that at this point, but
Just one more thing, Mr. Chair. It would be 5.2 million more for Minneapolis. I just want to make sure we're clear on that because it's 81,274 tons at a $65 more per ton. I mean, again, I think I'm getting what I just would like to understand it. So I think if we could progress, I just need to understand what we're doing.
Yeah.
Chair, I'll second the progress motion. What I'll just express though is the city is multiple things right now. So city has requested this of us and they have a policy that conflicts. And so that was my interest in the potential drafting because if we were to have approved this today as is, the literal last date we would approve is the same date that they are expecting the conclusion of waste incineration. I just had that incongruence, that inconsistency, I cannot part and parcel as separate. I want good governance on behalf of all of our residents and businesses. But again, I am happy to support a progress motion, and I am certain we will hear lots of perspectives in the meantime. Oh, sorry.
Commissioner Conley, yes.
Thank you. I just was gonna call out that the second be it resolving clause does say that the market rate of the city's agreement is contingent upon their formal approval of the agreement. So it is like saying the city has, like, should they choose not to, then, right? The way that I'm reading this is that then market rate is just contingent upon what the city does at the city council meeting on Thursday.
So I do want to just
Is that what you mean?
in the current what's before us,
In the-
that
what- in the
what we're voting on
Yeah.
actually doesn't have whereas clauses. There's a single resolving clause to approve the contract.
Yes, 85.
This is not before us.
Okay.
So
So I'm looking at that.
Yep.
But that does have.
Yep. So
I'll
they just want to be in transparency of what's
the
before
original
us.
one.
Yep.
So thank you. No, because that's another reason why I supported this, and we'll support progress. It's, I have no problem with that because it does spell out that formal approval. But I want to be clear too about other cities, and like we should absolutely be in the business of partnering with every city in this county who has these agreements with us. The specificity on the largest city in this county, who arguably brings the most trash into the burner that they want closed, is a cause of it gives me pause as well. So I think that there's agreements that can be made with other cities in our county that who have not like crafted legislation to close this thing that can be more nuanced and that administration, leadership, and public works can draft up what their accelerated zero waste looks like. With the new policy that we have in place, I mean, like everybody is going to be responsible for adhering to county policy that accelerates zero waste. Acceleration of zero waste is the ethical way that we close down the garbage burner, or that we just have no further use for it because it's just going to sit empty. If we really go hard on accelerating zero waste, which I'm very optimistic that we'll be able to do in the next few years even. So I represent Minneapolis, and I don't necessarily hear from policymakers about this issue specifically, other than getting updates from us. But I, again, support the progress motion, but want to just be clear that this R1 is comprehensive and it is very focused on the one city of the first class that we have, and whether or not they pay a reduced rate or they pay a larger rate based on the fact that from their own legislative action, they won't be utilizing the HERC after December 31st, 2027, is how I read their legislative action. Minneapolis is saying that they want to end incineration by 12/31. So my assumption is that 12/31/2027. So my assumption is that they'll be looking at other options come that date if we're still incinerating trash. So that'll be a Minneapolis jurisdictional decision that they will need to have to make. And until then, though, I think we should be doing what is in our purview to do, and this feels right. I will be quiet and support the progress motion now. Thank you, Mr. Chair.
All right, thank you. Any other comments? All right. All those in favor of the progress motion of the original language, sorry, not the R1 language, say aye.
Aye.
Aye. Any opposed? The item is progress to our full board meeting. Thank you. And with that, we are adjourned.
You're in the way of dinner.